So good afternoon, everybody, and welcome to today's meeting of the West Yorkshire and Harrogate Health and Care Partnership Board. I'm told this is the 10th of our meetings, and wow. Like many previous many of the recent ones, of course, with continuing issues around COVID, we're meeting online again today. But hopefully still in a format which allows plenty of participation from all our members, and also the meeting will be streamed and a recording placed on the website afterwards, so people can also look and follow on. We've got a fairly substantial agenda as always, and particularly highlight the update on the progress made on delivering on our action plan for tackling health inequalities, the report on the structure and dynamics and impact of the voluntary community and social care sector, the work on developing our governance arrangements in response to the legislation and in readiness for establishing the ICS on a statutory basis, and a report on how we're proposing to firm up on quantifying and measuring progress against the partnership's 10 big ambitions. As I said, we're meeting on Teams, so if I could ask people to mute themselves when they're not speaking. If you're able to use the raise hands function, preferably to indicate when you want to speak. If for any reason, I know Teams sometimes does funny things to people, you don't have a raise hands function, if you indicate in the chat, hopefully between myself and colleagues, we will manage to catch you all. Can I welcome certainly two new members I'm aware of planning to attend today, Councillor Lee from North Yorkshire County Council and Councillor Fenton Glynn from Calderdale. And again, hope you're not missing anybody else significant, but also take this opportunity to note and send best wishes to two regular members of the Partnership Board for whom this will be the last meeting. The first is Dr. Owen Williams, who's leaving Calderdale and Huddersfield NHS Foundation Trust after 9 years of their chief executive, and of course before that was chief executive of Calderdale Council, to take up a new post in the autumn as chief executive of the Northern Care Alliance Group, and also Martin Barclay, who's retiring after 5 years as chief executive at Mid Yorkshire Trust, and in total nearly 50 years service to the NHS. Both have made important contributions to this partnership and will be very much wished, and I'm sure we would want to wish them all the best for the future. So I think that covers everything I want to say in terms of introductory remarks. Obviously the timing's a little interesting because as we're preparing for this meeting, having the announcement about funding for NHS and social care, it's a shame we don't have more opportunity perhaps to reflect on that in the contents, but I'm sure we'll get some immediate reactions when we get on to Rob's update perhaps. So item 2 on the agenda is questions and public deputations. I understand that we've had notice of one question, and just to remind people that whilst we try to give an immediate response at the meeting, we always provide a fuller response which will be posted on the website afterwards. So can I hand over to Stephen for this item, please?
Yes, thank you, Councillor Swift. We've had one question from Jenny Shepherd. Lauren's going to show the question on screen, but hopefully Jenny's been able to join the meeting to ask the question direct. Jenny, are you able to join the meeting?
Yes, hi, I'm here. I haven't got a picture. My camera won't work.
That's fine. If you'd like to go ahead and ask your question, please.
Yeah, okay, thanks. So this is from Calderdale and Kirklees 999 call for the NHS. And I'd like to preface the question with a request that it's discussed by board members in this meeting and not left to integrated care system managers to respond to. We feel that the lack of board discussions of questions from the public is a real weakness. We bring questions here for all the board members to consider, but under the current process, this doesn't happen. And we feel that our questions are just like pebbles that skim across the surface of the meeting but have no effect on it. We had a public participation meeting with integrated care system managers back in March that are referred to in the minutes of the 1st of June integrated care system board meeting as positive. And we asked at the time for the contact details of the 4 co-opted members of the public on the integrated care system board, so we could ask them to take up our questions in the meeting. And we also said we need to know what their remit, powers and duties are, if any, but none of this has happened. But since I put in this question, fortunately, Stephen has sent me the link to the webpage where their details are, and one of the co-opted members actually emailed me last night, which I really appreciate, and said that before COVID, we were able to meet before the meeting to talk about things. Obviously, we can't do that now, but we've now opened up a channel of communication where we will be able to talk to the co-opted members of the public on the board, and I think that's really useful, and I'm glad about that. So this is the question. Please will board members discuss and comment on the fact that Rob Webster's Chief Executive Report doesn't mention the recent Conservative think tank analysis of NHS integration, which uses West Yorkshire and Harrogate integrated care system as a case study, and recommends on the basis of this that, quote, the government should drop from the Health and Care Bill legislation to put Health and Care Bill legislation to put integrated care systems on a statutory footing. This is because the evidence to date suggests that there is no clear link between integration and improved outcomes. Before charging on down this road, we need much better evidence that the integrated care system model is the right one to adopt. End of quotes. In particular, please will board members discuss and comment on the following findings from the Centre of Policy Studies that specifically refer to West Yorkshire and Harrogate integrated care system. First, the Centre for Policy Studies report notes some positive evidence in terms of delayed transfers of care in the West Yorkshire and Harrogate integrated care system, and I quote now, but there was a worrying and perhaps related rise in emergency readmissions to hospital, which had risen to 14.4% by 2019 to 20, overtaking the national average. Overall, there was no evidence of significant performance improvements. And again, there had been a significant increase in healthcare bureaucracy with a 20% increase in managerial staff since 2016. The establishment of the West Yorkshire and Harrogate Health and Care Partnership seems to have led to a degree of productivity decline, with greater inputs yielding no overall improvement in outcomes, even on an optimistic reading, in a region that has been cited as proving the effectiveness of the NHS England-led approach, end of quote. While, and I quote again, the gap between West Yorkshire and England in terms of cancer mortality rates did not close in any significant way from when the Sustainability and Transformation Partnership was set up, and I continue to quote, on average, respiratory disease mortality was 0.4% lower in West Yorkshire in the 3 years from the establishment of the STP in 2016 compared to the 3 years beforehand. However, the gap between West Yorkshire and England only closed marginally in West Yorkshire's favour in 2017 and 2018, with the gap then opening up again in 2019, end of quote. There is more analysis of other key health outcomes for West Yorkshire and Harrogate integrated care system that basically show no evidence of improvement since the STP was set up in 2016. And in terms of workforce, I quote, the NHS workforce in West Yorkshire and Harrogate increased by 6.5% under the STP and ICS to reach 2,290 per 100,000 population in the region. This rise was 40% greater than seen nationally, but the proportion of clinically qualified workers declined from 52% when the STP was set up to under 50% under the West Yorkshire and Harrogate Health and Care Partnership, end of quote. This is because, quote, there was a 10% increase in senior managers from March 2016 to March 2020, while the support and infrastructure workforces grew by 16% and 19% respectively. The clinically qualified workforce only grew up 6.5%. So that's the end of my my question to you, which is, I think I'm really asking you to discuss and comment on the fact that these important findings aren't included in Rob Webster's Chief Executive Report. And I think it's really important that the actual impact of these massive reorganisational changes have not yielded any evidence, any substantial evidence of improvement in healthcare outcomes for the West Yorkshire and Harrogate population, and that must call into question the wisdom and appropriateness of this Health and Care Bill legislation to put the integrated care systems on a statutory basis. So thank you.
Thanks very much, Jenny. Rob, I know you've had a look at the question and the report. Do you want to give some initial points in response?
Certainly, and obviously aware also of Jenny's request that partnership board members also discuss and contribute. I think the simple answer to the first question, why wasn't it in my report, is that it wasn't published till Sunday, and my report was circulated last Tuesday to members, so we hadn't seen it, Jenny. So it's quite a simple fact. In terms of the report itself, if we look at the findings, they're interesting and important, I think, to consider. They're also fairly partial in scope. So if you were to take the agenda for today, all of the business that we're conducting today would have no impact in terms of the considerations of that report, because it doesn't talk about race or anti-racism or the role of the third sector. It doesn't talk about some of the other things that we've talked about here over the last 5 years. So 6,700 people with hypertension who've been found to have hypertension under West Yorkshire Healthy Hearts, rolled out by the partnership based on good practice in Bradford, many of whom will no longer go on to have a stroke or heart failure. The 53,000 carers who we found as part of the vaccination programme for COVID, who are now registered and identified with the GP, who weren't previously, through the partnership of the third sector, councils and the NHS, and a substantial number of other developments which are not reflected anyway in this report. So I think that my view, having only seen it for a day, is that it does ask questions, and we need to look at it properly, and we need to discuss it, and we need to look at the broader aspects of it. But it's also very partial when it comes to looking at what work the partnership's done. I think you also quoted reorganisation and restructure. There's been no reorganisation or restructure to create the ICS in terms of a statutory body or vehicle yet, has there? This is a partnership of organisations working together to try and make a difference to those that I've discussed, working carers, informal carers, people with a learning disability, people from Black, Asian and minority ethnic communities, and so on. In terms of the workforce, I think the way that the numbers are presented is actually unhelpful. You would seem to suggest that a 10% increase in senior managers accounts for all of the growth in the workforce. I think actually the workforce being up 40% more than the rest of the country is a positive. The way that the information is described would seem to suggest that clinical staff and patient-facing roles are only in the clinically qualified group. Actually, if you look at the growth in the workforce over the last 5 years, what we've seen is substantial growth in staff providing support to clinical staff. It's healthcare support workers, healthcare assistants, technical staff and technicians providing support to clinical staff, and they're the vast majority of growth. So growth is in clinical staff, the support staff that you quoted, The infrastructure staff tend to be in estates, and over the last couple of years, particularly with COVID, we've seen substantial need for us to work on our estate. So I think what it could be read, I'm not sure if this is the implication from the question, that what we've done is invest in lots of managers to the extent that then means we don't invest in frontline services, and that isn't the case. So I think we're taking this report very seriously. As I say, I've only seen it for a day or so, and as a partnership, I think there's much more that we believe is the purpose of our partnership. And actually, I think the report talks about the 10 big ambitions that we have and how it's too early to say whether we've achieved them or not. So those are my sort of introductory remarks, and thank you for raising the question, Jenny.
Thanks, Rob. I suppose I'd add in terms of this agenda, yeah, whilst we may not specifically have a detailed discussion of this question, clearly some of the issues about performance do tend to come up in discussing Rob's report. I'm sure we'll do that further. But I think the most important relevant part of the agenda perhaps is the last item on the agenda, where we are trying to become much more objective in measuring our progress against the 10 big ambitions. And I guess part of the challenge in this is how far targets for the NHS should be set nationally, and how far they should be about locally and regionally agreed priorities, and that will also be a tension. So I don't know what you're saying about discussion, and I hope that meeting with the co-opted members and giving them some opportunity to think through a bit more about questions will be helpful as well. Or some of the themes of this will be picked up both in this meeting and in future meetings, if not necessarily in a direct discussion on this question at this point. But thank you again for the question. I'll move us on then to the next item, which is declarations of interest. So to remind members, as always, that we take on board in declaration of interest here the interests that each of us will have declared to our individual organisations, but also to remind people that if there's items on the agenda that you have a strong and clear interest in, then it's helpful to declare them at the time in this meeting as well. Next item is the minutes of the meeting from the 1st of June. These have been circulated. I'd ask if anybody has any points of accuracy on them, if you can indicate. And if not, I'll go to Ian, who will take us through the action log. Thank you, Ian.
Thanks, Councillor Swift. And just to say, you might have spotted there's a bit of a glitch on page 9 of the minutes. There's a bit of blue text that doesn't quite flow in the same way. The text's absolutely fine, but we'll obviously correct that after the meeting. In terms of the action log, Lauren's helpfully shared that now. So the first one, 21.1, was a request to bring further material and a further update back on the work we've been doing around our governance arrangements, which are considered later on the agenda. The second one there, 40.21, is the action from last December's Partnership Board in relation to the Professor Dame Donna Kinnair review, and it will bring a standard update to every quarterly meeting, and again that's on the agenda. And the action that's closed from last time, 2021-1, is the request that we take the work that we've been doing around public involvement through our Futures Design and Transition Group Chairs and Leaders meeting, which has happened at the end of July. So yeah, that's it in terms of the action log. Thank you, Councillor Swift.
Thanks very much, Ian. Any questions or comments on the action plan? Okay, in that case, let's go on to our first substantive item. And can I welcome Beate Wagner and Richard McCann to the meeting and ask Beate to introduce this item, which is about the work that's being undertaken on adversity, trauma and resilience, and the importance of that issue for health and care. Beate, over to you.
Thank you very much. As Councillor Swift said, I'm Beata Wagner. I'm one of the directors of Children's Services in West Yorkshire, and I'm also one of the senior responsible officers for the Children and Families Programme of the ICS. So today, my job here is to welcome and introduce our very eminent speaker. Really pleased to have Richard here. But it's also an opportunity to just very briefly give a little bit of context about the work that we've been doing as a whole system, both on understanding trauma and adversity, what impact it may have on our population, but also then our ambition for this understanding to really inform our interactions and our practice. It's a joint piece of work between the West Yorkshire and Harrogate Health and Care system and the West Yorkshire Violence Reduction Unit. Really reflects our shared commitment to, at the centre of what we want to achieve, is to prevent harm and to improve the well-being of our population. And particularly in that thinking around those who may be facing multiple difficulties, who may have complex needs, who may be vulnerable, or who may have experienced trauma either in childhood or as an adult. So to deliver that, we have a joint West Yorkshire Adversity, Trauma and Resilience Programme, which is led and chaired by Kirsten England, Chief Executive of Bradford Metropolitan District Council, and a real big energy and commitment from all the partners to deliver our joint ambition. Now, the ambition of the programme is to work together with people with lived experience and colleagues across all sectors and organisations to ensure West Yorkshire is a trauma-informed and responsive system. We want to achieve this by 2030, so just to reflect both an ambitious target, but also reflect the complexity and what that means, because it may seem like a long time, but actually it will require a lot of work commitment and engagement to achieve that. So just a few words about why we think that's important. We know that children and young people who experience adversity and trauma are likely to be at higher risk of poorer outcomes, of poorer mental health and emotional well-being, physical health, and may also be at greater risk at getting drawn into antisocial behaviour, may be disadvantaged at school, more likely to experience exclusion at school, and more likely to experience violence and exploitation. We know that adults who face multiple disadvantage as a result of trauma are 4 times more likely to get drawn into dependency on alcohol, far more likely to commit suicide, and more likely to be absent from work and experience depression. Now, this isn't about labelling people at all, and as Richard will absolutely remind us, how adversity and trauma and the experience of that actually can also lead to amazing amounts of resilience and strength. But it is to recognise that by all of our system actually being trauma-informed and understanding this, and then act in a way which doesn't reinforce the trauma, but which actually takes into account the trauma in the way we interact with our population, we can make a difference, and we can help overcome and do our bit to overcome and address some of the inequalities and disadvantage experienced by people who have suffered trauma. In order to achieve a big system change, we are trying to really work at all different levels, both at frontline, all the way from frontline practitioner to very senior leaders, and we have a growing resilience network, trauma and resilience network, with over 140 members who are key to this approach. And many of us present today actually made pledges around what we can do to advance informed approach. You will have had further details of the programme included in the one-year progress update that you've had with your papers today. And maybe again, just to illustrate the interest and engagement there is with this programme. There was a knowledge exchange 3-day event that we held in March with over 1,500 attendees from across the West Yorkshire system. So really, I think we're really keen. We're picking up from both places, organisations, that this is something that can unite us. We can be engaged in. All of us can be engaged in this. We know that in place there is a strength already around this work that we can build on. So the more we can do together to ensure we share good practice, I think the more we can do to really further this agenda and fulfil our ambitions of a trauma-informed system. So now, without further ado, I'm really honoured to have our keynote speaker here, Richard McCann. I know Richard also had an impact at the 3-day knowledge event, and his story and passion really inspired our participants. Richard is a Times #1 best-selling author, co-founder of the ICANN Academy, has been inspiring audiences across the globe, including speaking to over 200,000 young people during the last 15 years. I personally have heard Richard on not at the knowledge exchange, but at a different event too. He will today share his story and the strategies that helped him to not just survive, but to thrive because of his adversity. So really, really great pleasure for me to introduce Richard to the Partnership Board today. And I think he's here. I hope very much he's here. Over to you, Richard.
I think you're on mute, Richard.
There you go. Can someone give me a thumbs up? Can you see the brick wall behind me?
Brilliant. We can hear you now. Thanks,
expectations. I've got 25 minutes to share with you a flavour of what I do. For example, with the NHS Leadership Academy before the pandemic, I did this session, but it took a half day. So this is not everything that I do, but it'll give you, I guess, an opportunity to see a little bit of what I do. It'll be inspirational, and there's also some resilience techniques in there as well. So without further ado, I'll just jump to my slides, which hopefully we've got a black slide there, and we'll take you back in time. So when I was a young boy, got a big laugh this morning in Liverpool, where I did a 2-hour resilience session for year 11 in a school. They all burst out laughing, but you're not going to do that. That was me, age 5. Little did I know what was around the corner, because 6 months after that photograph was taken, my first school photograph actually, I was exposed or introduced to real trauma. I'd already been brought up subjected to adversity on a chronic level, like 126 visits by the social workers by the time I was 5, considered at risk, and we were at risk, and we were being neglected by mum and dad. They weren't doing a very good job of bringing us up. This is where I was brought up, first 5 years anyway, up at the Scotall, not too far from here, Scotall Council Estate, and this is mum and dad, described as feckless, and my dad as an ogre, quite accurate, big drinkers. Their parenting skills weren't what they should have been, but actually I'm really grateful for the social services in Leeds keeping an eye on mum and dad, because I've read the actual file, and they were doing lots to help and support them, and they were a tough case, let's put it that way, to contend with. Mum, heartbreaking to read, used to slash her wrist, psychiatric wards. I mean, it's a horrible first 5 years, but a week before my 6th birthday, and I assume some of you will know where we're going with this, it all went absolutely, well, wrong, shall we say, as far as we're concerned. My sister Sonia here shook me awake. She said, "Richard, wake up. Mum's not come home, let's go look for her." And we wandered the streets looking for mum. And after an hour at the bus stop, we came home. This is the actual photograph that was taken by a neighbour. The police were everywhere. Something had occurred. And we were taken probably by that first police car there to the local children's homes. Now, flats, but it was a children's home at the time. Beckett's Park Children's Home. I remember arriving there, and I quite enjoyed it. I quite enjoyed the attention, the fuss they were making of us. They told us to get changed out of our scruffy clothes, and they gave us really fresh clothes. I remember the smell actually of the washing pad, beautiful it was. So I was enjoying it until this police officer, bless him, crouched down beside us, and he said, I'll never forget his words till the day that I die. He said, I'm really sorry to have to tell you, but your mum's been taken to heaven, and explained that we weren't going to see her again. I didn't believe him, I have to say, and I prayed for mum to be brought back, and later that day, I thought they had brought her back. They took us into the visitor's room. It's on the right there, the visitor's room, and I thought, in a little 5-year-old mind, visitor's room, she'll be visiting us, and of course she wasn't. But there was a man waiting for us who took, police photographer actually, took that photograph. That's me on the left with the train, and that photograph appeared here in Leeds in the Yorkshire Evening Post later that day. And it was that picture, or this picture, along with the next one, which I hate, because you can't see it, but it has my mum's dead body on the front of the paper. I think that was shocking that they would do that. She was murdered that night, and if you don't know, she was murdered by, it was Peter Sutcliffe, the serial killer who became known as the Yorkshire. I won't even say what the second name was, you know who it is. Murdered 13 women. My mum was the first of 13 women to die. 13 that we know about, incidentally. And if you'd have told me back then when I lost mum, when we ended up in the children's home, that I would, one day be able to find a way back from that, well, I wouldn't have believed you, because I felt like my life was over. And that was my introduction to acute adversity. And I have to say that one of the things that I remember, it's important. Can I flick up a bit? 2 seconds, does that work? Yes. One of the things that I remember thinking, and it's really important for individuals to deal with adversity, or explanatory style, as Seligman calls it. My thinking was that mum had been taken away by God. My first school was Holy Rosary Catholic Primary School. I told myself that God had taken mum away from all the beatings so that me and my sisters could have a fresh start with my dad and his new girlfriend. And in fact, the following year, we set up home with them. 2 seconds, I'm getting a bit nervous with my technology. And so I guess I turned 6. Incidentally, at the children's home, they wouldn't let us speak about my mum. They thought they were protecting us from that, but I couldn't stop thinking about her. I also can't understand why they wouldn't let us go to her funeral. It wasn't until I was 16 years of age, over 10 years after she died, that I was eventually told where my mum was buried. Anyway, if you didn't know that about me, my question would be, as I asked you that year 11 this morning, could you tell that my mum was murdered by a serial killer? You can't tell. I know you can't tell. And one of the questions I get asked by the media when they find out that about me is, how did you turn it around? What I've got left, 20 minutes left to tell you how I turned it around. If I didn't have those 20 short minutes and you wanted a quick answer, I will give you the quick answer. It was my attitude, my I can attitude. I can overcome life challenges. Mum's death was just a start. I've got a few more to share with you. I can find the positives in every challenge that I've been through. I can step outside my comfort zone, speaking to people, not just on camera, live events. Used to hate it, petrified. But I told myself on February 8th, 2005, I told myself, no, I can overcome this fear. By the way, any I canners on the call, please feel free to interact and write in the chat if you've got an I can attitude, because I know most of you got your cameras switched off. Do we have anybody here with an I can attitude? Anybody in the chat? None of you. Look at you. Thank you for making me feel uncomfortable. I'm not uncomfortable at all, because I don't mind being uncomfortable. One thing you should do in life is get comfortable with feeling uncomfortable. We've got one. Karen, thank you. Loads of I cans. Yes. Well, it's a waste of time. Waste of time. Unless you follow it up with a few letters out of my mum's name, which was I will. It's not just I can, the belief you can do something. It's the willingness to do the work necessary as well. And of course, in order for me to bounce back in the way that I have had to do some work as well. I've had to reach out and get some support and therapy and such like along the way. Anyway, I'm really aware this is the condensed version of my presentation. I can, I will, I did is the hashtag that I would encourage anybody to use if you want to connect with me on social media. I've been speaking for 16 years and I have been across the globe. And although, of course, right now, resilience is really important because of this pandemic, it's always been important, bouncing back from setbacks, because we're not immune. None of us are immune from bouncing back or being exposed to tragedy, adversity, challenges, not just pandemics. Anyway, I've been saying this for 16 years. If you go through life with that kind of mindset, that kind of philosophy, not only will you achieve more, but you'll be able to deal with more. And nobody's ever come back to me and said, oh, I've tried that for 2 years, it doesn't work. It absolutely does. Sorry. I move on so swiftly, and I realise the clock is ticking. It's a bit of a challenge actually for me today. The following year, 76. Some of you might be able to remember the blazing summer of 76. It's quite like that today, actually. We set up home with my father, and up until this point, and his new girlfriend, up until this point, I've been asking myself, why my mum? And like I said, told myself it was God that intervened. However, it didn't quite turn out to be the positive life I was hoping for. Incidentally, as I said to those Year 11 students earlier today, a battery only works when you've got a positive and a negative element to it. That's the kind of the circle, isn't it? To have a great day, to have a positive day, you need to know what a bad day is, to have that to kind of compare things against. So, sometimes it's good to have some challenges in our life. Anyway, dipping into gratitude, this is one of the things I talk about in my bigger session. Gratitude, and by the way, I'm grateful, absolutely grateful that it was October when Mum died and not this time of year. Because had it been this time of year, we would have seen my mum's dead body on that field. We walked down that path on the field, she was there, we'd have seen her. Do you know, I'm grateful for that. So one of the exercises that I do get people, I did it this morning, is write down 3 things that you're grateful for every day. And what the science tells us, if you can write down on a consistent basis 3 things that you're grateful for, it increases your happiness level, so you're better equipped to deal with those things that might happen at a moment's notice. And so gratitude, top tip, write down what you're grateful for. We do it in our house. This is my bounce backograph exercise. I don't expect you to do it, we ain't got time. But I shared it with the NHS Leadership Academy and I shared it with those young people today. That's my life. As accurately as I can make it. It's the bounce backograph. You can work it out. My age is at the bottom. If things are going well, I'm in the green. If I'm faced with a tragedy, I'm in the red. You got the idea? You can see the red dot, the death of my mum. And what I get, as I did for the NHS Leadership Academy, I got them to do their own. And it happens every time with every person I've ever done this. They're always the same shape. I mean, it might not be exactly the same, of course, because of course you might be all right for 3 or 5 years where you're always in the green. But at some point you'll go through a setback. I have not met a person yet. But the great news is this. After every period in the red, this is for us all, you always end up back in the green, as long as you get some help and support along the way as well. And you always end up back in the green. Flip side to that is this. When you're in the green, as you can see here, there's always a setback around the corner. There's always a setback around the corner. So let me show you this. This is my revenue for my organisation, the Icon Academy. That's up until the pandemic. We were doing quite well, really good quarter. And then bang, look what happened. I didn't even earn enough money on a monthly basis to pay the shopping bill, let alone the bills. But I knew my explanatory style was this. It's tough right now, but we'll get through this because I've experienced it all my entire life. Post-traumatic stress disorder, you'll be aware of that, PTSD. PTG is the flip side to that, post-traumatic growth. We can grow in ways we wouldn't have done had it not been for the challenge. And by the way, that's where we are right now. So things are getting better for me. Actually, one of the things I talk about is the ray of sunshine or the silver linings in the dark clouds. I have an exercise where I get people to write down what was the good to come from that challenge or that dark cloud. And they can always find them. What was good to come from the pandemic for me was, do you know what? I've done so much work recently, the last few months. I'm sometimes doing 2 or 3 engagements a day, virtually, because we can. So I can do more work now because I can do it from my office, although I was in Liverpool this morning. And also, one of the ways that I've survived, the silver lining for me in this pandemic, is lots of organisations are saying, our staff need help with how to speak to camera. So I'm getting lots of work doing that. But you know something? It's just a conversation. It's just a chat. But what it is, a lot of people's explanatory style is, well, I can't speak on camera. Look at you all with your camera switched off. What's wrong with you? And anyway, I've got to move on. Silver linings in the dark clouds, they are there if you ask yourself to find them. 100 miles an hour. This is not as bad as my 44 talks in one day that I did for charity in Leeds twice. I did 44 5-minute pop-up presentations. It was tough, but we got through it. Anyway, so this is me as I'm growing up. This is when my explanatory style wasn't serving me too well. Mum's killer was out there killing more and more people. What we didn't get, and you'll know that people need this, not just young people. We need help. We need therapeutic support, interventions. We didn't get anything. Nobody knocked on our door. We weren't given any support at school, no pastoral care. And that meant I was creating this world in my head that wasn't based on fact. I thought Peter Sutcliffe was going to kill me. He wasn't going to kill me, but I thought he was, especially when he killed Jane McDonald, the 16-year-old babysitter that we had, the 5th person to die. Oh, incidentally, pause. The first innocent victim. They were all innocent. That's why when Peter Sutcliffe died, I asked West Yorkshire Police. Thankfully, we got it to make that public apology for how they spoke about what happened to some of the women, some almost deserving of what they got. That did not help my trauma at the time. The lounge that was spoken about, and that photograph of my mum, I hated it. Anyway, it's not all about me. Moving on. I started to go so fast. My dad was brutal, so it was out of the frying pan into the fire, actually. He wasn't equipped to look after 4 traumatised children. He may have been offered some support, but he didn't accept it. He used to beat us with sticks. He drowned the dog in the bath. He broke my stepmom's rib with a punctured lung. You got the idea. But despite that, I love the guy. You probably heard of that what's it called? I forgot the phrase now. In my ginger moment, that love. I forgot the phrase. Unconditional love. Gosh, I almost lost it there. Unconditional love. I know what that means. I love him as my dad, but I hated him at times as a child. Actually, the silver lining about my dad was at least he kept us together. If we'd have been adopted out, we'd have been spread around and not seen my siblings as often as I did. So, but I miss him. He passed away in 2014, and he got pneumonia, and he died in his flat. I had to unpack his flat. I just moved into a new granny flat, and he'd not even unpacked his bags. Anyway, I miss the guy. I miss him. But at least he was back in my life for 7 years. Sorry to move forward. So swiftly on, Mum's killer was arrested. Some of you lived through that period, I'm sure. It was all over, but it wasn't over for us because we still had my dad. He was still drinking, and we started drinking as well, actually. We started drinking, it was touched on earlier about getting into solvent abuse and such like. We started drinking cider, sniffing glue, sniffing aerosol cans. See, we did that, or I did that, to be accepted by my friends. My dad beat my sister so badly, Sonia, she was taken from the house by the NSPCC. And she never came back. She went to a children's home, and I missed her so much. But the following year, 83, yes, I'm 51, by the way, 52. Do you know optimistic people age more slowly? You can have that for free. And Sonia was taken, but the following year, 83, I joined the same school that Sonia was going to. I could see her again. Her dad stopped hitting me. But that year, something big happened. Somebody intervened in my life. Mr. Hill, my English teacher, who encouraged me to take part in the public speaking competition at school. I was nervous to begin with, but, you know, after his encouragement, I found that courage, doing the scary stuff. I found that courage to get on stage. I said I can at least try. And I spoke. And I spoke about, of all things, pigeons. My dad raced racing pigeons. It was my job to feed them. I spoke about them without any notes. I even took a pigeon in with me at school. I let the pigeon go out the double doors. And there it is. That picture was drawn for me by a woman called Mo Lee, who was attacked by Peter Sutcliffe at Leeds University. She survived. She channeled her anger into art, and she drew that picture for me because she knows how significant it was. I won that competition. And I'll tell you what, it's not a coincidence that I won that competition all those 37 years ago, and I'm stood in front of you virtually. Those two things are related. One of the things I talk about is facing your fears, taking those small incremental steps outside your comfort zone, which actually doesn't exist. Your comfort zone's in there. There he is, Mr. Hill, featured on the BBC a few years ago. Did a documentary about my life, and we thanked him publicly. And I grew because you do when you do the challenging stuff. But I got to 16, sorry to go so fast. I left home with no qualifications. Actually, I'm now taking my English GCSE. I've got a personal tutor, so hopefully, I'm going to pass my GCSE. I'll probably be 52. Anyway, I got myself, a job, living with Sonia there. My first job was in this mill in Castleton Mills, near Armley Gyratory, some of you might know that one. Then I worked at the Hilton Hotel in Leeds, washing plates, and I decided I've got to do something about it. So I took my life into my own hands. I went to a little village in the south of England. You probably don't know it. It was a place called London. Everybody know London? And I joined the army, told a little white lie. You see, I'd been affected by how the public and the press and the media and such like had talked about Mum. I was ashamed. So I said she died in a car accident. And they accepted that white lie. I finished my basic training. That's me, my basic training. And I posted out to Germany. Back in the green. Unfortunately, stuff happens when you least expect it, like a pandemic or whatever it is that's going on next year and the year after that. This magazine was published. My cover was blown. My secret was out. And people were saying to me, hey, Richard, this is you. McCann, Leeds, I had a breakdown. I ended up on the psychiatric ward of Hanover Military Hospital, where at last I was going to get some professional help. Or so I thought. They kicked me out, medically discharged from the army. I am unfit for army service, they said. But my silver lining was I missed Sonia, and I was able to move back in with her. The family has fallen apart by now. Pauline's left my dad. My two younger sisters are back in care. Well, one was care, one was a hostel. So moved in with her. And this is interesting. I got kicked out of the army. 2018, the British Army commissioned me to go back into the army to teach the officers how to stand and give presentations. I didn't laugh out loud, but I did find it quite amusing when they asked me to do that. I used to think officers were like above me and better than me. No, they're not. But all presentation skills, right? It's quite a level of doesn't matter what position you're in. Anyway, back to the story. Sorry for so quickly. I'd rather have 3 hours, but I haven't got it. Moved in with Sonia in this flat by now. She had a daughter. And I could have quite easily gone off the rails, and it might have been my mitigating circumstances had I done that. But no, I dusted myself down, as I've always tried to do, and started again. And I got myself a job stacking boxes in a warehouse in Leeds, down on Regent Street, a company called Honeysuckle. I was stacking boxes, but I got promoted to run the computer system, got my own place. I'm back in the green again. Unfortunately, I kept getting burgled 3 times. In fact, the insurance company cancelled my insurance. But what happened? I mean, back in the red, it inspired me to do something about it. I'll buy my own house. I'll buy my own house. Or even I can. To achieve anything in life, you've got to make some sacrifices. And I saved up for a deposit, or a little place called Methley, if you know Methley out near Castleford. And I'm back in the green again. Unfortunately, I was soon back in the red, but I have to take responsibility for what happened. I got involved with my friends at work in drugs. It was speed, it was ecstasy, it was cocaine. I started phoning in sick. I lost 2 of my friends. I also lost my job and I got sent to prison. I'm in prison here in Leeds. One of the most shocking things I've been through in my life. Locked up in a cell all day, not being able to go where you want to go, do what you want to do is a horrible feeling. But I used this explanatory style. It's what you say. That's the most important thing. I used this as an opportunity to turn it around. Change my circle of friends, stay away from the drugs, and never put myself at risk of returning there. I have been back a few times, though, but for the right reasons, to inspire some of the inmates there and the staff, I think. I got through my sentence. Let's share this with you, a quick one. It's a teacher whose explanatory style wasn't what it should have been 8 years ago. I met him in a school in Halifax, and after the session, he said, "Oh, I so needed to hear that." I went, "Why?" He's been telling himself he was too young to be assistant head. 32, go for it. He went for it, didn't get it. Went for it again, didn't get it. Went for it again. 3 times it took him. And I know that because in 2018, this was taken in 2018, I'm in a school in Wakefield, Cathedral Academy in Wakefield, Rob Marsh. He'd just become head teacher and he booked me 4-year groups. I was exhausted. But it gets, because we can always do more. That school was, with his changing mindset, explanatory style, the best secondary school of the year, the Times Educational Supplement, and he's now been promoted. He's over 3 schools now. A great example of changing that language, breaking down those imaginary bars. My bars were real though. Got through my sentence. I walked out the front gate on the left there. The joy of being released left me. 4 weeks later, I couldn't get a job. Nobody would give me a second chance. I've got a criminal record now. I even formed a suicide pact with my sister, Sonia. I didn't do it, of course, because the day we discussed it, she took the tablets and ran me to ask me to join her. It brought me to my senses. I ran the ambulance service here in Leeds. We got them into hospital, Leeds General Infirmary, and they saved my sister. What was I thinking of? That incident brought me to my senses. Went for my final job interview. Where is that? I've got a picture. Yeah, there is. Lawrence gave me a job. Where is that? Down not far from here, actually. Gave me a job. 1997, that was the start of the turnaround. Got promoted in that job and changed my circle. I took up salsa dancing. So important who you spend your time with. I got myself finally got myself counselling with her, Sandra Good. She still does it. And it was just great to sit down. It took me 2.5 years going through all those issues that I had. See, what I tried to do, and this is not a great resilience strategy, try to brush it under the carpet, hope it will go away. The cells of your body know what you've been through. You can't hide away from it. So I faced up to it. One of the best things I ever did. Kept failing in my relationships and it got better after that. Sadly, my sister Sonia here, she didn't get the help she desperately needed. She stabbed her boyfriend in Leeds in self-defense. I didn't kill him, but when she was released from the police station and she told me what it put her through, I made a decision to do something about it. I decided to write that book about my life. Incidentally, writing about your challenges is a resilience technique. It's called expressive writing, not for publication, just to get it out of your system and you can throw it away. Don't worry about spelling and grammar. Anyway, and it was really therapeutic for me to write that book. Did really well. I think it's in 11 languages. That's Sonia on the left. That's at Radisson in Leeds, the book launch. And knocked Robbie Williams off the #1 spot, became a huge #1 bestseller. Big deal. The big deal is the potential to do that was always there. It was always there. And that's my biggest audience. I've spoken over 3,000 times now. That's at the Leeds Arena. It was 4,000 teachers. I invited my English teacher onto the stage. It was an absolutely incredible moment for us all. So proud. Anyway, so that's what they've been to speaking. And I've spoken Iran, Malaysia, South Africa, Switzerland, Germany, all around the world. And I like to think of myself as a nice export for West Yorkshire and the region. But let me finish with a quick happy ending in 4 minutes. Gosh, this has been tough. I met Helen in 2004. Can you imagine the conversation? She said, "Tell me a little bit about yourself, Richard." I said, well, what it is, actually, we had a few things in common. Her mum had died of alcoholic poisoning, and so we had a few things in common. That's us getting married up on the Isle of Skye. If you're watching the SAS, Celebrate SAS programme at the moment, it's filmed on Sky, most of it, and that's where my mum lived. That's the house mum lived in as a teen. We got married there on her birthday. It was the closest we could get to having mum at our wedding. And look what happened next. Our daughter was born, Skye, named after the Isle of Skye. She's got a lovely head of ginger hair. Look at that. That's Wilma McCann's granddaughter. I love saying that. Absolutely stunning. Look at that. And she's just started in year 11 at a school in Leeds, which she's done really well. But we didn't stop at one. We rolled the dice again. There's my little boy, Ellis, named after the place we got married, which was Ellis on Skye. You know how beautiful it is there if you've been up there. And finally, my daughter, we rolled the dice again. We had another little ginger. Her name's Isla. Check out ilasgifts.co.uk. She set up her own business in the pandemic. She sells homemade lip balms with her brother. They made over £1,000 in the pandemic. It's incredible. Whew! And I'm going to finish now with a quick, I hope this works, a quick little video. So, by the way, my children have been exposed to adversity as well because their mum, my wife, Helen, was diagnosed with breast cancer 7 years ago. One of the ways that I got through that, she had a double mastectomy and reconstruction. When that consultant said to me, recommend a double mastectomy, inside my explanatory style, it could have been worse. She caught it early. She didn't even have a lump. She just got a feeling something wasn't right and she followed her instinct. And anyway, she's still with us. And she laughs about this. It was her joke, so not mine. Don't judge me on this one. I don't know if you know what they can do. They've made some lovely boobs made from her back muscles. And you know, like over time, gravity kicks in. Well, my wife's boobs, they stick out and they're not going to be affected by gravity. So every cloud does have a silver lining. And here's my little boy. Let's finish with my little boy who told his teachers in primary when he was asked, what do you want to do when you're older? When they asked him, he said, I want to be a motivational speaker. Can I finish with a quick little video of my little son? Talk about resilience, talk about facing your fears. And I hope this works. You might need to turn your volumes up and I'll press play. And
my first presentation was in front of 29 people at school in class. Then was 140, followed by 400, and my latest presentation was in front of 1,500 teachers at the Leeds Arena about 6 weeks ago. And each time I stepped outside my comfort zone, got bigger, bigger, and bigger. My thoughts are these: never underestimate the potential that lies within each and every one of you. That's you, in fact, that's all of you. Because if I can stand up here, aged 8, in front of 3,000 of you, then I've got a question for you. What can you do?
I think they are perfect words to end on. Listen, I'm sorry to rush through that so quickly. Just a flavour of my energy, flavour of what I do. My final words are these: if I can overcome the things that I've been through, by the way, I had skin cancer this year, being diagnosed. My doctor caught it early. I'm grateful for that. If I can overcome all those things, mum was murdered by a serial killer, children's home, beaten with sticks, all that stuff, kicked out of the army, prison, drugs, my fault, I appreciate that. And not only going to achieve more than I thought possible, but also deal with more than I thought possible. If I can, then you, your loved ones, your colleagues, and everybody around you can too. Bang on time with 25 minutes. Thank you very much. That's not my phone, that's my timer, but finishing bang on time.
Thank you so much, Richard. That was amazing. Lots of great comments in the chat and lots of applause for you. And wish we could have given you longer. Beate, is there any final points you want to make on this item?
I don't think I could possibly follow that. Thank you so much, Richard.
Thank you. I think that's everybody's reaction. So thank you again, and I'm sure some people want to follow up. I notice you've shared your website in the chat for people who want to comment. So thank you again so much. But what a reminder about the importance of understanding where people are coming from when we're working with them as well. Okay, so apologies. My next door neighbour's extensions started working again. I'll take us on to the next item, which is the update from Rob as partnership lead. And thank you, Rob, as ever, for a very substantial and informative report. But hand over to you, first of all, to sort of pull out key highlights and any updates you want to give.
Thanks very much, Chair, and thanks, Richard, for the session. And I think hopefully Partnership Board members have seen the paper from the West Yorkshire Violence Reduction Unit and the Partnership on the trauma-informed approach that we're taking. If we colour the approach that we take to people with that sense that everybody's got potential and our job is to help it emerge, then I think we'll be in a much better place. It certainly, I think, already infects what we do as a partnership, and much of the rest of this agenda covers that off. So, as you say, Councillor Swift, it's a substantial report as usual, and I have tried to slim it down a bit. I could have talked about a lot more of the things that we're doing, but tried to make it a bit shorter. So just about a few key points, and I'll take it as read. Obviously, we live in interesting times, and at the time of writing, we weren't aware yet of the amount of resource that's been made available to the NHS for the rest of this financial year, upon which we're expected to plan. And the expectation is that the planning guidance will be coming out next week. As you said earlier, there's been an announcement whilst we've been in this meeting about additional resources for health and care, and I don't want to comment on that because I've not seen the detail. But it is helpful that we now know how much money we'll receive for the rest of the year, and we wait for the planning guidance to come through from the NHS around those elements which we need to collectively deliver. And many of them will be what's covered in this paper, I think. So just to draw out 4 or 5 key points from the paper. The first is that we are in a period of sustained infection from COVID, which is being mitigated substantially by the vaccination programme. And we know that thousands of lives are being saved because of the vaccination programme, and that the extension of the vaccination programme through the partnership to younger age groups and with an evergreen offer for people who haven't been vaccinated is part of the reason for that. We have higher than average rates in West Yorkshire compared to the national average, and what we're seeing is a sort of sustained number of people in our hospitals and a smaller than previous number of deaths, but there are still people in hospitals and there are still deaths, and there are still people with long COVID. So what we're asking the public is to work with us, really, because we are here and we're available to provide support and care.
other workers, and we expect them to be skilled, and we're proud that they're skilled, but we also just need to treat them with respect and dignity. And any social care plan that doesn't start to address that is just failing on those points.
Thanks, Josh. I'll take some more comments if that's all right, Rob, and then come back to you at the end. Anything specific. So, Kathy and then Fiona.
Thank you. My question, Rob, is about winter planning. So sort of completely different area. We're going to go into a winter that like no other, and we thought last winter was a winter like no other. I just wondered, from your perspective, how the ICSs can support places. Every provider is looking at winter planning. Places are looking at planning at the moment. But what's the ICS role, and perhaps what learning that we gained last year would be helpful in going into this year?
Thanks, Kathy. I'll bring Fiona in and then come back to Rob, because we're getting sort of two topics now going, aren't we? Fiona?
Yeah, thank you, Chair. I was back to the previous topic about the announcement this afternoon that I've also been sort of skim reading through as well. I think the other point to mention with regard to council funding is, as big employers, we're also really hit by the increase in national insurance. I've just been getting a text from our leader about the millions of pounds it will cost us. So actually, in addition to the fact that, you know, the public have already been paying for, you know, cuts to social care funding through the precept, this funding, we're not going to get very much of it. And it actually really feels like giving us money with one hand and taking it with the other, because we're obviously going to be very impacted to the tune of millions by the increase in national insurance. So it's, I think for local authorities, this really isn't good news. I'm really surprised that ADAS have come out positively. I'm really shocked to read that, because actually I can't really see how this, I mean, they've said it's a step in the right direction, but actually it's a teeny tiny step, and we're also going to be clobbered on the national insurance. Thank you.
Yeah, thanks, Fiona. And I assume the national insurance impact is, well, I've not read the small print, but again, that's going to affect the NHS as well, of course. And so again, there'll be an offsetting impact, I assume. Rob, do you want to come back on most points, see if there's anyone else?
Sure. I mean, I think the first point would be that, you know, this is a true partnership. So we've always said this is a true partnership between local government, the NHS, communities, third sector. So we have to look at things in the round. So I think the issues around local government financing, the fact that social care budgets are the biggest and most significant majority, I think, of local authority budgets now, mean that when you can't really divorce the two. And Jonathan Webb and colleagues from council financial teams have been doing work on what does our collective financial planning look like, and what more can we do to make sure that we're looking at all of the pressures and opportunities together. So I think that's the first thing to say. I think that we should all be advocates for social care as well, and I think we've tried to do that really strongly and positively from the NHS as much as from council and social care colleagues. And in doing so, I really recognise the point about social care is there for people. It's not there it's not just there for the NHS, if you like. And the people we're talking about are children, people with a learning disability, adults of working age, and older people, not just older people, which is what the narrative tends to be in the media. So very clearly the case that on all those agendas, if we've got a true partnership and we're looking at the model of care, then we need to do that together. And really grateful for the emphasis on how we deliver care and what it looks like in an integrated, joined up set of services. And then if we extend that sense of this is a true partnership, then that's the same for the workforce plan that we have and the opportunities that we give to the workforce. And Brendan Brown, as the chair of the programme board, looking at workforce, and colleagues from HE and elsewhere are always clear that the opportunities that we're looking at are available to care staff and health staff, and we need to plan for both. So as we do the next iteration of the people plan, we're going to have to make sure that we address these issues in social care together. Kathy, on the winter planning, so what we've done, I think, over the last year and a half is really improve our collective management of what started out as an emergency response and has ended up being as how we do the business. So we have good, gold, silver and bronze command arrangements in each place and in each organisation that links that place. We have a good gold command for our hospitals collectively. We have a strategic coordinating group every week for the partnership, and that fits into the local resilience forum. So what we said is, going into the winter, we'll have something that can oversee the delivery of services during distressed periods, which is what we've been doing for the last year and a half. And we'll have a plan. And Pat Keane, who's also on the call, is coordinating the work on the plan. And I don't know, Pat, if you want to say anything about what you're doing at this point, because winter planning started a little while ago. But I don't know if you want to say a couple of sentences just to give people an indication of what we're doing.
Is Pat on the call?
I can see his name.
Call, Rob.
Oh, right, okay.
Yeah.
Okay.
Lou, I don't know if, yeah, Lou might be able to give a couple of brief updates.
So in terms of process, we constantly work through the A&E delivery boards because that is the local process. So we meet in the silvers and golds within each of the places, but through the A&E delivery boards, we're just kicking the tyres on the plans that are already in place, because this is a continuation of what we've been doing all year, and it's not just winter. Those plans will be reviewed, and we'll be doing that through the Urgent and Emergency Care Programme Board, so we can look across, do a bit of comparing and sharing of good practice, and then we will use that to bring together the ICS plan, and that will link in with also the H2 planning, so the planning for activities, etc., that will be developed when the planning guidance comes out, and that should all come together within the next couple of months so that it's coordinated. So that's the process behind it, if that's helpful.
Thanks, Lou.
Thank you. Rob, I don't know if you've had a where the time, if you noticed in the chat, I mean, earlier Helen made a couple of comments following up from the discussion around Jenny Shepherd's question at the start, and Angela's put a point in there which perhaps really sort of reflecting on the wider issues. If we might have question marks about the specific measures and claims made in the Centre for Policy Studies report, there is probably a question going forward, which you might feel is partly part of the last item on the agenda, about what the evidence is about the partnership leading to better outcomes, and what work we might want to do about that to get that message over coming forward.
So I'll give an example, and I'll let Robin Tuddenham, maybe I'll give him an advance warning that as the sort of population health lead, he might want to say something about the work we're doing. But I think that version of West Yorkshire Healthy Hearts is a good one, isn't it? Where what we've done is taken a piece of good practice in Bradford, which previously hadn't been adopted anywhere else, and rolled it out across West Yorkshire. And for those 6,700 people who have had their hypertension case found, and now means that they're managing their hypertension and will no longer, much less likely to have a heart attack or a stroke in the future. That seems to me like a positive evidence-based intervention, which has been focused on some of our more deprived communities. Similarly, I think if you look at the work that we've done on stillbirth and maternal mortality, I think stillbirths are at their lowest since 2015. And what we've seen is a focus on more deprived communities, some of our ethnically diverse communities in terms of ongoing care and support. And we've seen substantial reductions in some of the negative outcomes for those populations, 15 to 20% reductions in some of the key indicators. So I think we've got some good evidence. I think the Centre for Policy and Management Studies was looking at hospital discharges and those sorts of indicators, whereas ours were broader about outcomes. So I don't know if Robin or Ian want to comment further.
Thanks. Ian's indicated, so I'll bring him in.
Thanks, Councillor Swift. Yeah, I mean, I guess just to remind the board, we do have a compendium of examples of things that we have done over the last 4 or 5 years, including work on stroke, diabetes, vascular, unpaid carers, maternity, investment in the VCSE, and they're all available on our website. We can ping those around again if that would be helpful for people to see, but we do keep a bit of a log of those things where there is sort of tangible benefits. It might be, making sure we've got the right visibility around some of those things.
Thanks, Ian.
Yeah.
Robin, is there anything you want to add before we? Yeah.
Well, I was just going to say that I think the point that Rob's made is really important, that the Centre of Policy Studies report was very focused around some of the kind of acute outputs and some of the focus on some of the key conditions, which is understandable and right. I think the way we've worked through the ICS is about the whole health and wellbeing agenda, and there has just been a really good piece of work that Karen's done, which I think we could share, which is collating some of the examples of kind of integration into outcomes, which we've shared with the local government association this morning to kind of give the example of a rich picture. But some of the examples, I think, through the pandemic has been, it's always difficult, isn't it, to disentangle the elements of the system that make the difference. So I think it's quite difficult, but the work we've done around homelessness through the pandemic, the work we've done around multiple and complex need, and the work we've done around trauma, it's not just a very powerful example in the presentation from Richard earlier, but it actually fundamentally shifting the practice into early intervention, into community services, and into better outcomes in terms of housing people and dealing with a whole range of their physical and mental health needs. I think the response that I could talk a lot about but won't for time is the way we've responded to the Afghan crisis, and actually were proactively one of the first places in the country to not only step forward but actually work with NHSE about better data, access into vaccination, public health screening and support, is one of the effects of the collaboration we have across the NHS, local government and the VCS, and very much with the VCS in capitals there, who've led that work from community. So I think there's a whole range of examples of where we've built in the kind of factors that determine health and well-being, and the ICS has created relationships in place, across place, and in the system that's led to different responses. And certainly when you look at us in a national context, they really stand out and a good learning. But there is a really good piece of work that Karen's pulled together, which probably we should share again, because I'm not doing it justice, because they are just some of the early, very current examples. Of which the vaccination uptake work we've done as a system, I think, has also some strengths around the role of faith communities. So the way that we see health and care within the whole system context is developed very well in Karen's document, which I think we should share. Thank you.
Thanks very much. Yeah, we'll make sure that we share that. I'm aware there could be a lot more that be said on that, but I'm not seeing anybody else want to comment on Rob's report, so I'm going to move us on at this point. I apologise, Fatima and colleagues, that we've already sort of started eating into the time. We do have a fair number of items on the agenda, but obviously this is very important. It was great to take part in the launch of the anti-racism campaign and have a chance to see a few of you in person. So Fatima, Sarah, hi. And Portia all lined up for this item. I'm not quite sure who's going to start, so I'll hand over to you.
Thanks, Chair. I'm just going to hand over to Hayden just to kick us off and do some introductions, if that's okay. Over to you, Hayden.
Thank you. Just to confirm, you can see my slides, and if I touch the keyboard, they do move.
Yes.
Okay, fantastic. We're cooking on gas. So just by way of introduction, so as Fatima said, I'm Hayden, and I am a graduate management trainee here at the partnership. And I've got the privilege actually of coordinating a lot of the things we do around the independent review, and hence being here today. So obviously we've also got Fatima and Sarah, who I'm sure you all know, and we've also got Portia Roberts, who'll be feeding back on behalf of the VCS Voices panel, who kind of scrutinise and acts as a critical friend on this work. So before we kind of get into the bones of the update, and offering that sort of assurance, to the board, it's sort of worth taking a minute or two just to sort of reflect on why we're here, and the context of the update. So as you will all know, agreed by the board, we're here fundamentally because we agree that this should be a standing item, really recognising the importance of this work and this agenda, and actually recognising that need to move at pace, which we absolutely have, and which you will see in kind of what's to come. And so through the shared action plan we had that was agreed, I believe in December or March, partnership board, forgive me, I wasn't here at the time. We're continuing now to deliver a system through programmes, and equally and really importantly in our places and at neighbourhood level. It's just worth bearing in mind on that point that everything you'll see today is not necessarily everything going on around the system. I think capturing all that would be quite the task. But in this period as well, and I think we've heard some of it already in the updates that have come before about those challenges and about the context within which we are meeting today. So I don't think there's need to sort of rehash all those challenges, but really to not mention them wouldn't be to sort of afford them the sort of respect they deserve. I think what's actually really important though is that, and as we've already said, that despite those challenges, we're still making progress. And actually, some of the changes we're actually seeing that we're using it as an opportunity to do more or to embed in pockets, which is really great. So that's about where we're at and why we're here. So in everything that follows, we'll kind of show you a bit more of the detail of what's been happening, some sort of structural commitments, some overviews of progress, some launches, which is really great at both system and at place level. And as mentioned, Portia will take you through the feedback and the thoughts from the voluntary and community sector panel. So with that, Fatima, I will hand over to you.
Thanks, Hayden. I'm really cognizant of the chime, so I'm not going to overlabour some of the elements of the slides and assume that the report has been read. But obviously, as Rob has mentioned and Councillor Swift has mentioned, we were really proud to deliver one of the key actions from the plan, which was the launch of the anti-racism movement. This was co-produced by colleagues from the Race Equality Network, members of staff from across our partnership, but also, a real testament to the hard work of some of our comms and engagement colleagues as well, including our fabulous Karen Coleman. One of the immediate demonstrable bits of impact is the number of organisations that we've signed up, not just across the partnership, but nationally, which just reinforces the importance of us setting the tone not only within West Yorkshire and Harrogate, but the country. We currently stand at 563 organisations signed up at the moment. That was on Friday. I'm sure that will change as time progresses and the impact increases. One of the other key areas that I think is of interest, particularly reflecting on Jenny's comment and question, is about how we're continuing to really improve representation and recruitment into clinical and non-clinical roles. One of the key areas of feedback from the review was about representation and really being overt and going into communities where we don't normally go into, and being overt about our aspiration of having representatives or people from those communities coming to work within our organisations. And that is something that we're really proud that Brenda Brown and Sarah Brewer have been leading on and have made significant progress on in regards to apprenticeships and really developing that talent pipeline into the partnership and into those clinical roles. In addition to that, one of the other things that we're really trying to focus on is the retention element of keeping our fantastic clinical colleagues working within our partnership. A key element of that is the resilience and the mental health support. And in order to do that effectively, one of the key elements of the review feedback was making sure that was culturally competent and met the needs of our diverse staff groups. And one of the key things that we've been working on recently is making sure that we facilitate that with the mental health provision, and that's moving at pace and hopefully we'll be starting to deliver quite soon. As Hayden's alluded to, our aspiration is not only to deliver this across the system, but also to mandate our Sheila test and make sure it reaches our communities. communities. So one of the key things that's been working, particularly in Leeds, is really focusing on how we can recruit and retain people from communities that we wouldn't normally engage with, particularly when it comes from mental health recruitment, because we know that that is an area from another element of the review that people were not having the best experience possible. And a key element of making sure that improves is having a workforce that is reflective of the communities that we wish to serve. Another element, as I mentioned, is ensuring that we're looking after our NHS staff, and that is both health and care, and Bradford are really leading the way on that particular agenda. And I've already mentioned the amazing work taking place in our places for the anti-racism movement. Next slide, please, Hayden. And then again, this is very much linking into another element of the agenda later on today, which is our system ambition of making sure our leadership is reflective of the communities that we serve. Really pleased to share with the board that our High Potential 2 cohort is up and running. We have some great representation, and again, a real reflection of the talents across West Yorkshire and Harrogate's Health and Care Partnership. I think it's really important to recognise that some people weren't able to participate in the cohort because it wasn't the right time for them. But again, because of our commitment to really supporting the potential of our colleagues, all those individuals have received mentoring support and are very much on that journey to being ready for the next cohort. There's also an aspiration, and again, this will be launched in our fantastic Inclusion Week, which is happening in October, and opportunities for colleagues on the board, as well as System Leadership Executive Group, to work alongside the Race Equality Network members on a reciprocal mentoring programme, really supporting the development of talent in our system, as well as our organisations and places, and really making sure that we deliver our ambition of a leadership that is reflective of the people of West Yorkshire and Harrogate. What we're also doing is moving at pace with the review of the recruitment and selection processes. What we're hoping to do is a two-phased process. The first is to develop and co-produce a blueprint or a consistent approach for all the partnership organisations, who can then amend and make bespoke to the need of their places and organisations. And again, we're hoping to launch this in autumn, so all those are thankfully on track. The other bit that I think is really important, and we're very, very proud of this and the uptake this has had nationally, is the racial inequalities training. One of the key elements that came across in the review, but also through numerous conversations that I've had regionally and nationally with leaders, is that need of a tangible toolkit or resource to enable them to go into their organisations and their places to really address some of the complex issues when it comes to race inequality. That training, the allyship training as well, has been received really, really well, and again is available on our website for colleagues who want to continue to use that. And one of the reasons why this is so important is because it addresses the wicked issues. So you can meet the target but sometimes miss the point, which is the culture within the organisations, and empowering our colleagues with the tools and skill sets that they need to manage everybody to fulfil their potential. There's also an opportunity for colleagues to have some bespoke career mentoring conversations, and this again comes from feedback not only from the review but from the Race Equality Network, about the fact that some people are really talented, but at some point when it comes to the recruitment process, particularly the interview point, they're just not reaching that top scoring mark, and that may be because of the makeup of the interview process, or it may be because there's a gap in the skill set. And one of the key things that we want to do is really transform the way in which we deliver that to make it as inclusive as possible. The final thing just to flag to colleagues is the fact that this isn't something that is just happening across system, it's very much happening within our programmes as well. An example of that is the work that the Plan Care programme are doing to really commit to providing placements to our fellows. So there are a number of fellows working on programmes across the partnership. Obviously, you remember Amrit was one of those, and they are now working within our places as well. So this is very much us living up to our commitment of supporting people to fulfil the potential and giving them the skills and expertise they need to move on to that next level. Again, there's some context in places which I'm not going to go into because I'm just mindful of the time, but really reinforcing that this is very much something that is getting embedded within the DNA of how we work within West Yorkshire and Harrogate. I'm just going to pass over to Sarah now to take you through the next steps.
Thanks, Fatima. I'm just going to cover off some work we've been looking at in terms of population planning since the last meeting, and the mental health requirements as well. There's a lot on there, so I'm not going to go through it in lots of detail because I'm mindful of time, but just pull out a couple of the key pieces of work that we've been looking at since June. So we put a successful application in for £200,000 for some targeted CVD prevention funding. So that's going to be working in partnership with voluntary and community sector and primary care network to look at targeted CVD prevention. And one of the requirements from the national team was to look at both deprivation and ethnicity. So we're working to identify some PCNs to work on that with at the moment. So that should be a really nice project that we can bring back and share some quite tangible outcomes with. And we're working in partnership with the Healthy Hearts programme on that as well. It's been mentioned a couple of times that we're working on the proposal to become an ICS of sanctuary. So what that means is looking at how we learn, embed and share to improve outcomes for our vulnerable migrant population. And we've set up a community of practice to drive that forward as well. And we're progressing that work with some of our local and national partners, so working with voluntary and community sector organisations to learn from that as well. We're working on our diversity and representation with our ICS Future Design work, so making sure we've got that diversity in all networks on the board. And we've been doing lots of work with the Harnessing the Power of Communities to look at voluntary and community sector representation in the work that we're looking at as well. If we just have the next slide, please, Hayden. Thank you. And I'm really excited to share, we've got some case study insights here as well. And these have come from our Health and Equalities Network, so some funding that we put across for our Health and Equalities resource that went out last summer. So it's £500,000 we put out, and these are some of the case studies that are coming back. So some really nice local examples from Calder down Kirklees, and some examples that we've been working with for priority population groups as well. So we've been working with Solace on vulnerable migrant population, some really lovely feedback here on being able to cope better with stress from people who've been working with migrant health population on mental health. And also we've been working with Leeds Gate, who are a charity working with gypsy and traveller populations across Wakefield and Bradford. So they've been able to deliver an extra 200 consultations and extra support for people. We've actually carried on some of that funding with some resources that we got from NHS England to do some targeted resources to help health and care staff understand the needs of gypsy and traveller populations. So that's a video that will be coming out in the next few weeks, where we're working with community champions to co-produce that. So we should be able to share that before the next programme board as well. And I'll just move on to the next slide on mental health. Lovely, thanks Hayden. So a few outputs from the mental health programme. They've been working on the commissioning element to have a real specific focus on ethnic minority groups in men, which has come out through the programme board. They're also working on the mental health and wellbeing hub and really looking at what the links with ethnicity there are as well. There's a real focus on that. And I'm happy to say that the mental health programme have now recruited a health and equalities lead. This was a specific ask in the recommendations to have a better links with the inequalities in the Improving Population Health programme and the mental health programme to real focus on health inequalities. So ethnicity will be included in there, but wider inequalities as well. And we're also in the process of working through recruitment for a mental health consultant to work across the mental health provider collaborative, which will again have a real focus on health inequalities. And finally, these Harnessing the Power of Communities have established a VCSE reference group to work on the mental health wellbeing hub as well. So hopefully we can get some real key sort of community level input into that group from the voluntary and community sector organisations. So I'll hand back. I think Portia's going to give some feedback now from the VCSE panel that met a couple of weeks ago.
Yeah, thank you, Sarah. As it says, the panel were particularly keen to see further development of data around ethnicity pay gaps, because it's critical to actually demonstrating change and movement in the right direction. And it was the question of all leaders across the whole system should have a target in their appraisal processes to actually reflect on how they're actually supporting Black colleagues, ethnic minority colleagues to develop within the organisation and establish a more diverse leadership system. But particular emphasis we felt, apart from looking at how we're doing at the moment, was around the commissioning process. There's a lot of good practice going on across the partnership. You know, there's a lot of things, a lot of work that's happening that the panel felt needed to be celebrated. The commitment to a more diverse sector, the commitment to recognising how we, particularly as a BAMI Black voluntary sector contribute to the overall health and well-being of communities, fantastic. And a lot of that is down to the commitment of the senior leadership. And we wanted to actually establish that as a statement that we really appreciate the leadership that's coming down from Rob and the rest of the team, because without that, we know a lot of the things wouldn't be happening right now. But the key issue for us now is how do we make sure that that translates to activity throughout the rest of the partnership, and particularly across the system. And critical to that is the commissioning process. The commissioning process is key because that is where access to resources is really going to be embedded. That's where it's going to come from. But not only that, the commissioning process is the point at which we can weed out those organisations that aren't necessarily delivering. And I'm trying to synthesise the discussion here, but essentially, commissioning is an entry point, but it's also a barrier. As an entry point, it needs to be accessible, the systems need to be transparent, and there needs to be support for organisations to access those entry points to go through the door. But there needs to be support for those managers who actually have to manage the system themselves. So it's how do you get the system to reflect and respond to the needs that are, or the commands, if you like, that are coming downstream to them. Because being involved in regeneration in the past, we all know that one of the most significant blockages to enabling new organisations to access commission, the point of being able to be tender or even access information about the tender, is that tier of management. So as a VCSC panel, that's where we need to see more action taken, and that's our challenge to you, if you like. That's our challenge to the board. How can that further develop? We've got a number of infrastructure organisations across the partnership, but they're at different levels. We understand as a panel that there are different levels of support available, because infrastructure organisations themselves exhibit a variance in the resources that they have available to them. And it's how can we equalise that across the partnership? Because you've got smaller organisations that haven't got access to the same levels of support. How can good practice be shared across the districts? So it's stripping things back now to say, well, we've got the really good policy, we've got the good things being said and spoken, but how do we actually translate that into action in a way in which the smaller, perhaps, organisations that are working perhaps with the more vulnerable members of the community, how do we make sure that they're supported? How do we make sure that they get a place at the table? How do we ensure that in 5 years' time, those Black-led organisations, and I'm saying Black in the political sense, so it includes all minority communities, how do they ensure that they're going to be sustainable going forward? I'm trying to think. There's so it's the challenges. How can we make the commissioning process work to ensure that the Black, BAMI, VCSE sector continue to be supported, their activities reflected in action, and we can build on some of the fantastic work that's already been started. So
thank you, Portia. So again, in the interest of time, just to kind of wrap up, so as ever, and I think really noting that the sort of substantial updates that have been provided, recognizing we didn't get the time to really deep dive into all of them, but I think what we can see is it's substantial, it's meaningful, and there are really good examples of making a difference here and now. So with that in mind, we'd like the board to obviously note the progress and support the approach that's enabled us to achieve those things, both at the structural level, but supporting progress within all our respective organisations as well. And I think particularly on this one, we've got the qualitative insight into our leadership and the difference that's making, which is fantastic and absolutely necessary. It would now, we feel, be of added benefit that we can demonstrate that impact quantitatively in a consistent way across the system. And so we'd like the board to support consistent data collection across the partnership and support providing that the assurance of that in this forum on a biannual basis. And finally, and really in recognition of the contributions that these people have made, we'd like the board also to support the continuation of the shadow board structure in the forthcoming ICS structures that will be established. Thank you very much.
Thanks very much. So helpful summary of the recommendations at the end there, which I take it we're happy with in principle. I think the final point about the shadow board obviously just needs to be picked up in the discussion about new governance arrangements to make sure that it fits. But I'm sure in principle it's it's a principle we'd like to see continued. Just perhaps aware in the recommendations that the specific issue which was flagged up on the previous slide about commissioning for BAME organisations, there wasn't explicit mention of that, and perhaps we can just ask to make sure that relevant colleagues take that one away, and also just to flag up that obviously the point about data collection, I guess that's something that you would like us all to take back to our own organisation and make sure there's support for that. Fatima, you want to come back on something?
No, Chair, it was just to respond to your suggestions. So the action about the VCSE and the commissioning statement, we can take that as an action to explore outside the meeting the best way to sort of facilitate and respond to that. And then just to sort of clarify that final recommendation. So the Race Equality Network has significant representation in a number of decision-making panels in the ICS, and we want to celebrate the contribution and difference that's made, but also ensure that that continues to happen as we move forward and evolve into a future partnership.
Thanks. Yeah, I mean there was not an agreement about that, and just want to make sure it's done in a consistent way. Portia.
Yes, it was just to basically emphasise that the commissioning process was something that the panel got particularly exercised about. It is crucial, and we feel that without work on that, a lot of the things we're going to lose. So it was really just to say that it is a key priority.
Thank you, and that's recognised. Rob.
Just to say, Chair, I think we should probably make sure we touch on this in the next item as well.
Sorry, Rob, slightly lost you there. Touch on this in the next item. Was that what you were saying?
Yeah, because obviously we're talking about contribution to the third sector, and what Portia's highlighting is there's a nuance to that we mustn't lose.
Yeah, absolutely. Okay, not seeing any more indications, so we're happy to agree those. Oh, Fatima, yeah.
My apologies, Chair. It was just to sort of bring to the Partnership Board's attention that Alison Lowe will be stepping down as Chair of the VCSE Voices panel to take up her new role as Deputy Mayor for Police and Crime. And it was just to note our thanks for her sort of commitment and leadership on that particular panel and throughout the review, if we may.
Yeah, agreed. Perhaps we can note that and thank that in the minutes. And sorry, I saw another hand. Sima.
Thank you, Chair, and thank you for the paper. Just a point from the Race Equality Network, because we reviewed the papers yesterday, chimes a bit of what Portia's just said in keeping up with the momentum of the work and making this a reality. So, there's lots of initiatives that are happening, which is absolutely great to see, which the Race Equality Network have been part of. But it's really starting to look at how we embed them and really drive that cultural change that is also needed alongside the initiatives that we're obviously working on. And the point about the data collection, I think Hayden absolutely agree with that, and the Race Equality Network were supportive of using that data to drive the work going forward, but also wanted to point out about how important it is to capture seldom heard voices in some of that data as well. So not just the numbers, but the stories as well, because how does this work that we're doing have an impact on those people that may not necessarily be part of the Race Equality Network?
Thank you. Okay, so we're happy to agree those recommendations. Thank you for the report, and to note the thanks to Alison as well for her work. So thank you for that item, everybody. So I'm very aware we have quite sizable time pressures. Maybe though, I find it helpful if we could just sort of take a 5-minute comfort break and resume at 4 o'clock. And that makes making the cup of tea pretty fast, but I'm sure we'll all manage. And apologise in advance to people on the latter half of the agenda whose time's a little squeezed. So I'll see you all shortly. I think normally the suggestion is for people to just turn the microphones and cameras off until 4. Thank you. Okay, I was probably pushing my luck by saying 4 o'clock, but we're starting to see people coming back in. So I think if it's okay, we'll crack on and make a start. So I think we should have with us for this item, I think we should welcome Professor Tony Chapman from University of Durham and James Flanagan from the West Yorkshire Combined Authority. But I'll go first of all to Hilary Thompson and ask Hilary to introduce the item, if I may. So over to you, Hilary.
Thank you, Councillor Swift, and thank you for the opportunity to present this research. The structure, dynamics and impact of the voluntary sector and the social enterprise sector was a piece of combined research done on our behalf by Professor Tony Chapman, who I'm really delighted is going to present the findings today briefly to you. But it was the West Yorkshire Combined Authority, it was our partnership, Yorkshire Sports Foundation, Community First Yorkshire, and the Humber Coast and Vale ICS that all came together to put this research package and commission this work. And it's all about the scale and the significance of the voluntary sector and trying to help our partners understand the complexity of the sector and the value that it can play in changing and working with the system to support what needs to happen in the health and social care world. And we're sometimes probably out there working like mad, paddling like mad, like ducks under the water, and people don't quite appreciate what's going on and the complexity of what we do. So I'm going to hand over to Tony. I know he's got an awful lot of information that can be shared, and hopefully you can talk really quickly and condense it down from the agenda to keep us on time. So thank you, Tony. Over to you.
Okay, hello. We should have some slides, I think. I'm not sure who's putting those on for us.
I think Lauren has the slides.
Yeah, they're going to come on for us. There's only 5. It won't take us very long to get through.
Hi, Hilary and Professor Chapman. I'm just opening those up for you now. Apologies.
Thanks, Lauren. I think it's important to say that in this research, there's an awful lot of information and it can be digested down into big chunks, little chunks, and made very appropriate to each place. But I'll hand over to you now, Tony.
Okay, well, if we just move straight on to the next slide, that's the best thing we can do. The research was commissioned by a partnership from West Yorkshire Combined Authority, the Health and Care Partnerships, Durham, and also Humber Coast and Vale, Yorkshire Sport and Community First Yorkshire. So it's an unusual commission for me, really, because it's not just one person, it's several people. So there's lots of interest, lots of different things that they were looking for, and we've tried to find a way through that. But I think what's genuinely different about the research is that once we get beyond the point of getting the baseline data in place, which I'll tell you about in a minute, we then collectively move towards making some decisions about how to define the value of the sector. So I gave a good deal of kind of groundwork, if you like, and advice on how you might do that, but it was a collectively owned decision. And also we went through a consultation process with 20 odd organisations, both within the voluntary sector and in the public sector, and pushed the ideas past them as well to see whether people would accept what we argued. I think what we're lacking at the moment in research on the voluntary sector is convincing and robust estimates on the economic and social value of the sector. So that's what this research has tried to do, and I think it's a greater than local importance. It's a project of more national importance because the same methodology can be used in other areas, and I will undoubtedly be doing that. Let me tell you a little bit about the data we used. The research relies on Charity Commission data, data from Companies House, on cooperatives and so forth, but also organisations, sports organisations, CICs and so forth. So we're really most concerned with the registered sector. That's the sector that we're looking at. So while we estimate there's around about nearly 15,000 groups and organisations in your area, only about 6,500 of those are registered, and the research is primarily about them because they're the ones who are more formal in the way that they're organised, although the vast majority of them are very, very small. Okay, so if we think about the size of the sector, it's probably bigger than you think, is one of the bubbles that says it, but it's also, I think, important from the context of your board to recognise that the sector is not malleable and docile. It's not there to be managed or to be strategically pointed in certain directions. The sector will go its own way in many senses. There are many interests expressed in the sector about what it wants to do, many of which are associated with health directly in terms of, say, delivery of services such as social care, or aspects of supporting people either before they go in hospital or afterwards and so on. But I think what the research shows us that that's a relatively small proportion of the sector who are involved in contracts and so forth, the ones over whom you have, shall we say, a measure of control on how they do things and defining what they do and sometimes how they do things. About 16% of the sector get involved in contracts. That means that 85% of the sector don't. As organisations get bigger, they're much more likely to get involved in the kind of contracts that you're talking about. So around about 66% of the biggest organisations will get involved in contracts, some of which will be associated with healthcare, but a third of them don't. So it's important to recognise that the sector is autonomous. It does things its own way, and it often, collects the resources to do things its own way. It's not beholden to one client, really, on hardly any occasions. I think the other thing to say about the sector, there's often a lot of talk about the sky falling in and crises in the sector, but actually the sector is much more robust than anybody thinks. Unlike the business sector, organisations are much more sustainable. They're much less vulnerable financially than many businesses are. Now that might shock, surprise people to some extent, but if we think about it, it makes an awful lot of sense because charities tend not to borrow money. They tend to live within their own means. So the NCVO, for example, over the last 20 years has tracked expenditure versus income. On no occasion has the sector ever spent beyond its means. It always lives within its means. So that makes it more sustainable. But the other point to make is that the vast majority of organisations are very small. They don't employ staff, or if they do, it's maybe one part-timer or something of that sort. So money is not really what drives the bulk of the sector. It's volunteerism which drives the sector. It's about people doing things which they choose to do. We'll have another slide a little bit later about volunteers, so I won't say too much more about that at the moment. I think the other thing is that I've used the term here that the sector is organic in the way it's organised. It's not a system. There are tensions and stresses within the sector. People approach things in different ways. They do things for different sorts of purposes. There's a good deal of disagreement on what the right thing is to do. And obviously this is to do with values where people in civil society can choose what they want to address, the issues they want to address, and they may run contrary to those of others. So when we're thinking about sector value, we have to kind of be very careful about how we try to if anyone tries to say that the sector can be directed or strategically directed towards certain issues. At the top of that slide, you say there's 4 key impact areas. Now, the purpose of that is to say that the sector does focus on certain sorts of areas, such as personal health, which is one of the biggest areas of focus, well-being, financial security, which is helping people who are at financial risk quite often, and also around community well-being. But the point is that these areas all interact. You can't carve out just the health organisations. It's just not possible to do that, because many organisations which don't have health in the title, or even might not subscribe to the idea that their health organisation do contribute towards it, often through either deflection from healthcare issues, or things to do with, say, sport and exercise, when we're talking about different aspects of healthcare. So everything interacts. If we move on to the next slide, would be a good thing, I think. So that's the one we're looking for, yeah. What's the value of the sector? There's quite a lot of pressure at the moment at a national level, but also in regional levels as well, at local level, to be able to make estimations of the financial contribution of sectors to the local economy. So I was tasked with this to think of methods of doing it. Some of it's tried and tested. The study relies heavily on third sector trends, which has been running in Yorkshire since 2010. We did a baseline in 2010 for Southampton University. Since then, we've done a survey across the area every 3 years. So next year is the next time we actually do it. So we've been tracking it. And those of you who kind of want to look at the report, you'll find there's some trend data there to say what's continuous, what stays the same, and what changes. But what we haven't done is looked at economic value. Now, what we've tried to do is to draw a distinction between sector energy and sector outputs. Energy is the resources that the sector uses to achieve what it does, and the sources of energy are money, from grants and foundations, from fundraising, from gifts, public gifts, from contracts, from trading, and so forth. And money is very important to a part of the sector, but not all of the sector, not in equal measure at least. So big organisations need a lot of money. Their chief executives are more likely to lose sleep over money than the very, very small organisations who rely on volunteers. So we obviously had to encapsulate somehow the energy that volunteers put into, and it's quite substantial. And the later slide will say something about this. The other thing that we also interested in is assets as well. The sector does have a substantive asset base upon which it can draw in order to do its work. I think what we're saying in terms of economic value is that the energy the sector puts in is around about 1.6 billion in your area. I wouldn't say the whole title because it's quite long. And then we can pretty well double that in terms of its economic contribution in a multiplier sense. So that's the way that organisations spend their money locally, the way their staff spend their wages and so on. The sector is using conventional measures such as GDP or GVA doesn't work so well because the sector isn't hugely productive in the sense that some of the other sectors are. That's because it doesn't produce money with money, it produces social value with money, which is a different element. So we needed to find a way of actually estimating in a plausible way what we understood by social value and how much it was actually worth. And we came to the conclusion that it was at least 1.6 billion. In other words, it's equal to the energy put in. And if you think about this additional value, it's kind of intangible in lots of ways. Now, people, press academics quite often to find a statistic to show exactly the value of the third sector, but that's very difficult because there are different viewpoints on what counts as being very valuable, and also the work that the sector does. That value isn't a constant. So you'll know in healthcare, of course you do, that healthcare professionals or within the voluntary sector may well make a substantive contribution to people's lives. But it doesn't mean that those people will maintain the advice or keep to the advice that they're given, or that they won't need to be back again for something else because of other things that arise. So value has to be renewed all the time. So the sector needs to be replenished. So if we move on to the next one again. Okay, just to say this about the volunteers. We've got very strong evidence on volunteering. and it's clear that 80% of the voluntary sector would not be able to continue unless they have volunteers. They don't just rely on occasional volunteers, it's regular volunteers who give regular time, that they can work autonomously quite often, and also that they have expertise, obviously, to get things done. Now, volunteers includes trustees, but it also includes other people involved in delivering things. There's a huge amount of time is invested. If you think about this energy of the sector, 147,000, nearly 148,000 volunteers, 10.6 million hours, it's worth at least 145 million a year, just in your area. So volunteering is vital, but again, it can't easily be directed. And I think when people make assertions that there's somehow a major pool of untapped energy of volunteers in the area, that can be misplaced, partly because they're insufficiently skilled or their values don't match with organisations. And also some people don't want to. They do so much in their day job that they find volunteering difficult. So we have a kind of a civic core of volunteers. In your previous item, you were looking at issues around Black and Asian and minority ethnic communities. The civic core tends to be more white than the population in general. And there is an issue there which needs to be addressed, where it could be that some aspects of charitable activity repels people from taking part, or they don't feel welcome or in some way. So there's so volunteering, that there could be more potential, but it would need a culture change in order for that to realise itself. We've done quite a lot of research actually on diversity in the report, which compares the northeast of England, northwest of England, and Yorkshire, and that looks at chief officers and chairs of organisations to see what the balance is. But we don't just look at ethnicity; we look at age, we look at education, we look at disability as well to try and see what's going on. And it's clear that, again, within the voluntary sector there is a civic core which leans more towards a white and middle class and quite often faith oriented group of people. So the process of shifting towards a more diverse population will take some time. But the earliest stage of that is quite often to be more welcoming of beneficiaries and volunteers from different communities. Okay, if we just move on to the last one, I think. How to value the voluntary sector. I think we've done quite a lot of work actually in the past at Durham on relationships between the public sector and the voluntary sector. And when I say public sector, I'm including the local authorities and health authorities. And I think you have to be a little bit careful about what you wish for. I've already said a couple of times that the sector is not organised in a systematic way. It can't be directed. It also has its own value perspectives and ruggedly committed to its independence in lots of ways. I think also the notion that the public sector sometimes says that we want one door to the voluntary sector so that we can just get easy access and find out what we want, and you won't find that one door. You'll find many doors, and you need to be patient about that, and to some extent be respectful of the fact that some organisations will not necessarily want to play your game the way that you want to play it. So I think working well together is about having a clear vision from your side about what it is that you want to achieve, which of course you do already with your strategic plans, but not to expect that people will just join in. It's probably better when creating those visions to use a forum, has been mentioned in the previous session, to use forum as a way of hearing those voices, and not as expecting those voices will fit the way you want. I think investing in the sector is important. There's all sorts of ways of investing. It can be all kinds of in-kind support. It can be capacity building or capability type building support. It can be investing in infrastructure, organisations within the voluntary sector to lend support, especially to small organisations who tend to use them most. But when you think about value, I think the point to try and retain is that even though it's quite difficult to very specifically pinpoint the financial value of your spend on every occasion, what you do know is that if they weren't there, your cost would be a great deal higher, especially these tangible things. One example we give in the report is about a tea dance, another one is about a voluntary library, and asking ourselves, well, what contribution do they make, which is financial, and it's often minimal. A tea dance, we're talking about pennies, but in terms of keeping people active, giving people things to look forward to, giving people things to argue about, to be honest, to keep them animated, is actually worthwhile. So don't try to be too demanding about specificity. I can't say that word. Specificity. There is a change, are all very well. Transformation is all very well, but much of what goes in the sector is about keeping things going, and keeping communities and people well. I think is what we're doing. So trust is important, and monitoring is not always so important. Sometimes just trusting a judgment is the best way to work with the sector. Okay, I'll stop there because I know everyone's going to be exhausted by the end of the afternoon.
Thank you very much, Tony. I'd just like to add that what we're asking today is that the board note the findings and use the findings and use these both at ICS level but at place level. I think Tony's highlighted the significance of the contribution that the voluntary sector make. We do things our own way, but we do it because we care, and we do it from the heart, and to really just value what we can provide and not always look at trying to put us in your boxes. So thank you.
Thank you, Emily, and thank you, Tony, for that presentation. Fiona, you've got your hand up, and then Therese.
Yeah, thank you. I was very interested to read this report because I've worked in the third sector for 25 years. I only came out of it quite recently to become a full-time counsellor, but and until 2 years ago I was the chief executive of a mental health charity in Leeds. I have to say I found this report somewhat dry for a sector that's just built on love and passion and innovation and creativity, but I do get that it had a specific purpose, which is around demonstrating economic and social value. However, there's a couple of points I wanted to make. The first was around the emphasis on volunteering. And I suppose I wanted to make a point that the sector makes regularly and that you will probably all know, which is that volunteers aren't free. It takes really significant organisational investment in terms of both time and money to recruit and retain volunteers. I'm saying that having run an organisation that delivered mental health crisis services and ran a helpline that was open every single night of the year on volunteers, and actually ultimately it wasn't sustainable and we ended up having to employ paid staff to work alongside volunteers. So I think commissioners I think sometimes people think volunteers are like obviously there's loads and loads of benefits of volunteering, but it's not a kind of cheap or free way of delivering services. It takes a huge amount of investment to maintain a volunteer workforce. The other point I wanted to make, which is the more significant one really, is that I felt that this report missed something incredibly significant around the value in economic and social terms of the third sector, which links very powerfully to our passion and our primary reason really to address health inequalities as a system. And this is where the third sector has a huge value in reaching communities that struggle to access statutory services. And I think a really key difference between third sector and statutory services are that by definition third sector services don't have statutory power or statutory responsibility. And that makes them much more accessible to people who, for really, really good historical reasons, are often really worried and concerned about accessing services run, for example, by the council or by the NHS. So Leeds Survival Aid Crisis Service, the organisation I used to run, has BAME, trans, deaf and LGBT specific services, which like many third sector organisations, their services run by people for those by people from those communities for people in those communities. And the third sector has huge reach into diverse communities that we often don't have as a council or as an NHS system. And I really think that's a huge gap in this piece of work, is demonstrating the specific value, especially in the light of the pandemic and the health inequalities that have been exacerbated and highlighted. The value that the third sector has in its reach to people from diverse communities is missing from this report. And I think if there was to be any further work, that needs to be focused on. Thank you.
Thanks, Fiona. I know there was a lot in that. There's various other people want to comment. So if it's okay, I'll bring everyone in and then come to Tony and Hilary at the end, if that's okay. Please.
Yeah, thank you. It's just to share some work that we're doing in Bradford, which is very much related. So our place executive has asked myself and our Darcy and McBeath to work with the voluntary sector, because they've come to us as a place leadership and said there are particular issues around sustainability and issues around real valuable leadership and involvement in our place structures. So we have taken that forward as a programme of work. Ian and I have met with our VCS colleagues once. We've got quite a lot of actions to go away and do. We're looking at a compact. We're looking at an infrastructure grant. We're looking at involvement of the VCS and our SPA, because we really value their involvement in the work that we're doing in Bradford. And I really note the piece in the report about the diversity of the voluntary sector, and it's not necessarily the big voluntary sector organisations, it's some of the smaller ones. So just to share that, Chair, and when we have sort of got down the road with that work, very happy to share what we're doing in Bradford.
Thank you. That would be great. Really helpful. Kathy.
Thank you. Thank you very much for this report and demonstrating the value. I come from the voluntary sector, so I've been part of preparing these kind of reports before at city region level. I'd be interested in, perhaps not for this meeting, to understand whether there are any anxieties or concerns that the voluntary sector have at this time in undertaking this piece of work and demonstrating to the wider partnership. But that's perhaps a conversation with the ICS team. My question is particularly about commissioning and procurement. Public sector, particularly NHS commissioning and procurement, is incredibly inaccessible to the voluntary sector, and sometimes low risk, small amounts of money enable the voluntary sector to go out and do quicker engagement and consultation on the redesign of a service, for example, much more quickly than anyone in the NHS can do. And I'm just wondering, with this whole opportunity from April and the way in which we can look at commissioning, how we could perhaps be nimble and more agile in enabling different sectors such as the voluntary sector and small organisations to be part of that. So Rob and Ian and others, I don't know if you can answer that today, but I'd like that to be considered, because then we're being much more inclusive in the way in which we work in partnership.
Thanks, Kathy. Owen, and then Sima, and then come back to Hilary and Tony.
Thanks, Councillor Swift. I guess my thought process is one of really of challenge, actually, to the voluntary community and social enterprise sector, particularly in relation to the diversity of leadership point. I think it's, I don't know, maybe it's been a bit of a convenient narrative to say, and there was a reference to white middle class and so on and so forth. But I guess my challenge is, whilst I do accept that the VCS as described here does have much more connectivity with diverse communities, I still think it's problematic that, you know, when Javed Khan announces his retirement from Dr. Bernardo's, and I know that Therese has made the point that whether it's at large scale or whether it's at small scale, but the fundamental point is the diversity of leadership with the VCS is just like it is within other parts of the public sector, and for that matter, you know, the FTSE 300, so to speak. And I think I would like to know that West Yorkshire is a place that makes a breakthrough on that, and so that we become a bit of a national exemplar. And I just wonder as well, you know, certainly with the voluntary and community sector organisations within our system, whenever they're looking for trustees or senior colleagues, you know, I do quite a lot of work of trying to encourage diverse colleagues within our own organisation to get involved as a part of their personal development. And I just wonder if there's something more proactive we could do on that. But I think my fundamental point is I don't think I can allow the people in the VCS leadership community to have a pass on the lack of diversity in its leadership, in the same way I wouldn't expect anybody to give me a pass for my responsibilities in that respect. So I'd like to see some commitment around that and some movement.
Thanks, Owen. Sima.
Thanks, Councillor Swift. Yeah, my point, I think, builds on what Kathy and Fiona were talking about before, about that representation and those links into the community. And it's just sort of thoughts from the partnership about end user involvement in some of that strategic planning as it relates to the third sector, and not just across the partnership, sort of at that place level.
Thanks, Sima. So I've still got Rob and Karen, and then I'll come back to Hilary and Tony to wrap this item up, if that's okay. Rob.
Yeah, so thank you, Tony and Hilary, for the report. It's really good to see. And thanks to the contributions of others so far in the debate. I think Councillor Venner makes some really good points about connection, and Owen's challenge is exactly the right one, I think. If we, as you were talking, Tony, I was thinking, yeah, that really, some things really chimed with the way that we work here. So the point about, you know, measuring value and trusting some of the investments that you make fits with when we put £1 million into the third sector to help tackle loneliness. The way that we fed back on that was to everybody to showcase what they'd done with the money. And I think, to Rachel Loftus's point, you know, if you could bottle the joy and happiness on that day from the people who came along and told you what had happened with the money. So that's an example, I think, of there are things in this report that we've done well, and there are places that do this well. So Therese talked about this. You could point to Leeds and the neighbourhood networks, which provide a good infrastructure for the third sector and so on. What I really want to try and grasp, I think, is what do we need to do next and when? Beyond, I know Hilary's general, can we just keep this in mind when we're coming up with our next plan? Are there some things that we must get right? And are there some lessons for other programmes, I guess? So, for example, Owen Williams and I were discussing social value from the investments in the redevelopment of HRI recently, and that kind of sense of value over, you know, economy and social value is something that we need to do. So what specifically do we need to do next, and when, in your view?
Okay, and finally, Karen.
Thank you. You'd expect me to come on this, wouldn't you? Because we are one of the largest social enterprises, and you would expect me to come and say a little bit about this. So I think there is a huge piece to do here about measurement of the impact that we're having, and we are not good at that as social enterprises, but more widely across the VCS sector. So there is a huge amount of work we need to do around that. I think the inclusion challenge that you put down on the table, Owen, is really valuable, and we need to step up to that. If I think about my organisation that's delivering care right across, you know, Kirklees, Bradford, etc., we have to be able to reflect the communities which we are serving and working in. So I think that's really important. I think there's something for us as well within the sector about how we help and support each other. So there was a discussion before about the complexity of contracting and all that business. Some of us are much closer to that and we could be supporting others in that system. And I suppose the final thing I'd say is to make a plea of, you know, this is critical and integral. And I know you all know this, but it's critical and integral to what we're trying to do across the ICS. And we need to value this and make sure the voice is heard and included. And I know it's a hugely diverse sector, but there's something really powerful in here that we need to value and make sure is heard. So thank you for the opportunity.
Thanks very much, Karen. Thank you, everyone, for a broad range of views. Hilary, Tony, is there anything you want to immediately respond to? I think all of that probably added richness to the report, but Tony, yeah.
Yeah, I mean, I'll come back very briefly. I can't respond to all of the issues because I've got a list of 15 seminars here on a piece of paper. And apologies if it came across as being dry. It's an objective report. It's as objective as we can get it, based on years and years and years of work, which we've been doing in Yorkshire, the North East and the North West. So it's not a flash in the pan. It's a 14-year piece of research which starts again next year. And when we come back next year, you know, that's when we'll start to explore a number of issues that you've been raising here as well. We've done partnership analysis in a great deal of depth over many years. We've looked at all sorts of issues around volunteering over the years as well. So I can't kind of cover it all at the minute. But I think what's different about this one from compared to the other things we've done is that we feel that you need to give more time to debating the relationship, rather than trying to pin it down necessarily, but just actually talking about it. And towards the end of the questions there, around about, you know, we really need to get on top of measuring impact. Well, maybe you don't actually. Maybe you can leave that to the you know, the big study we do every 3 years, and really it's about talking about impact. I think you can divert an awful lot of energy into it, because quite often when individual organisations measure impact, they do that to show that they're a great organisation compared with the next organisation. It can actually be quite counterproductive rather than beneficial. I think really it's about drawing a distinction between impact in an economic way and judgment about value. Now, it's been quite difficult in the last 20, 30 years for health organisations to really think about impact in a non-judgmental way. The reason for that, obviously, is that, you know, new public management techniques about kind of measuring things, assessing things, targets, and all these sort of things have affected the way that people think about what counts as valuable. And I think we kind of have an opportunity to push back against that a little bit at the moment. The mood is pushing a bit that way. And I think when you mentioned about £1 million put into isolation as an area of investment, and I imagine there were all sorts of organisations came out the woodwork to do that, as they do around other issues, because arts organisations do it, sports organisations do it, health organisations do it, community organisations do it. Isolation is one of the biggest things that everybody says they do. If you look in the report, you'll find this is one of the biggest areas that people say they focus on. And the reason that is because the sector is about joining people up, getting people to actually engage and take part in things. But the thing about civil society is that it becomes kind of invisible because we're so lucky to have one. And I think the report does kind of make this point about learning to make judgments about, you know, the invisible value of the sector is actually really, really quite worthwhile. It's more of a state of mind than a load of numbers which tell you what's what. So that's one kind of key point that I'd make. I think the other thing asked about, you know, what do we need to do next? I think probably you need to reflect on what you already have. It's not kind of like a day one sort of question. It's about where are we now? Where were we? You know, we have all the data there. Where were we 10 years ago? What's changed? What hasn't changed? What's worth investing in that's really going to cause a major change, and what's not? You know, keeping the sector going is actually a really important thing, and recognizing that no one person, no one organisation has control over that, because all organisations, large and small, tend to rely on all sorts of different sources of funding, and they juggle it, they mix and match, and they shove it around to achieve what they feel is important. So, you know, attribution, I think if the debate is about attribution, we really don't get anywhere. I think it's driven us down something of a box canyon of the last few years. And I think many funders now are starting to recognise, oh, let's not worry so much about attribution, because, you know, others are going to play the same sort of part in what we're doing as well. It accumulates, you know, value accumulates rather than just being a question of.
Tony, we're going to have to control our passion. I think it's evident that we could debate this for long and hard, but I'm conscious for Councillor Swift that we've got to move on. I just ask people to share it, read it, digest it. We have a couple of seminars coming up, a 1 hour lunch that Joe's running in a few weeks' time. We have the opportunity in October when we're saying, you know, ask tomorrow's questions today. And this is the beginning of some work, and I think we will be coming back as a partnership group to do further work with this, and thank you for the opportunity.
Thank you, Harry, and thank you to everybody who's contributed, as well as the direct contributions. There's been a lot going on in the chat as well, so it has generated a lot of interest and discussion. I'm sorry we haven't got any more time for it now, but the other links you said are really helpful, so thank you. Could I just check, Rob, before I go, ask for your advice, Rob, or Ian, before I go on to the last two items? I'm aware we've got like 15 minutes left, two quite significant items. I guess we definitely need at least to highlight the key issues on the governance report. And how far we want to spend time on the performance report, or whether we'd be better bringing that somewhere else. Ian, are you going to answer that question for me? I've seen you put your hand up.
Well, it's a suggestion. I mean, I think we do need to cover some of the governance stuff now, so I'd suggest we do that quickly. On the 10 ambitions work, we've had a bit of email correspondence and a little bit of interest from a few folks, so perhaps on that we could take any comments by email and then look to establish a bit of a smaller group to look at it with us, and do that in the coming weeks. I don't know what you think, Rob.
I think that's a really good suggestion.
Okay, thank you. Okay. People happy with do that? So let's go on to the Health and Care Bill governance arrangement, and Stephen Gregg, can I ask you to introduce this?
Yeah, thanks, Councillor Swift. For those who don't know me, I'm Stephen Gregg. I'm the governance lead for the partnership, and this report updates the board on work to develop our governance arrangements following the publication of the Health and Care Bill. I'll be brief as time is tight. Overall message, I think, is we're progressing well with the work. I think with working with colleagues from across our places and sectors on the governance arrangements has really demonstrated the value of working collaboratively, sharing, learning and solving problems together. I'll emphasise kind of three key points about the work so far. I think firstly is we're building on what we've already demonstrated works for West Yorkshire and Harrogate. We've got strong places, we've got mature provider collaboratives that are working well, we've got well-established relationships, values and behaviours, and they're delivering better outcomes. Now, we've had the debate earlier in the meeting about this. In the paper, there's a link to the difference our partnership is making, where we collect those things together. So this is something that is making a difference. It's not just governance for the sake of it. These collaborative arrangements are making a difference. And we want to make sure we continue to use our language of primacy of place, subsidiarity, distributed leadership, and align with the legislation, not be driven by it. So that's the first point I wanted to make. The second point is clearly this partnership board, which will become, under the new terminology, our integrated care partnership, will have a key role in setting our ICS strategy, and that strategy will continue as now to be built from the place-based strategies agreed by health and wellbeing boards. Most decisions will continue to be made in our places under the principle of subsidiarity, and that's absolutely key to ensuring that the specific needs of our local communities are identified and met. And thirdly, it's important to recognise that things like the integrated care board and the integrated care partnership don't reflect the entirety of the decision-making framework that makes up our ICS. The ICP will set the strategy, the ICB will have a key role in executing that strategy, but that's within the context of a much wider framework that already exists across our system. And at Annex D, I've just attempted to map out a draft outline of those new arrangements. So those are kind of three key messages. I just wanted to say a little bit about some of the key issues we've been covering. Main focus has been on developing the governance models that will enable resources and authority to be delegated to place. And places are each working through the approach that best meets their local circumstances. And again, I think in doing that work, we're learning, the places and us collectively are learning from common issues and challenges that everyone's facing. Supporting that, we've developed a set of common governance standards, which we think we need to apply right across our system, because although we want to have different approaches where that's needed, we want to have some consistent standards around transparency, independent challenge, citizen involvement, etc. And those standards are set out at Annex B. Thirdly, we're very keen to ensure that the new arrangements support our values, and in particular, looking at how we can improve diversity in leadership and decision making across the partnership. We've already discussed that at some length already during the meeting. But so we're exploring how we can build on things like the fellowship, mentoring programme, the shadow board to develop the leaders of the future and link our approach to the wider work on tackling inequalities and the big ambitions piece. We've done some initial design work on system level governance. As I say, the partnership board is already, in a sense, our integrated care partnership. We just need to do some work to make sure that our membership in terms of reference align with the guidance when that comes out, but I don't anticipate any significant changes. And as I say, the strategy will be delivered by the ICB board, and we're looking at how we can shape that board in a way that looks, feels and functions differently from traditional boards. So we're moving away from the kind of exec, non-exec descriptor to one which illustrates the different perspectives that representatives will bring to the board. For example, place representation is not required in the legislation, but it's absolutely central to our approach, and so it's a key part of that proposition. And finally, just to say something about the proposed name of the ICS, proposing that from April 2022 the partnership will be known as West Yorkshire ICS. Harrogate Place will be part, as it is now, a part of Humber Coast and Vale. Our work with Harrogate Trust will continue through Wyatt and the clinical networks, and patient flows are unaffected. But we want to reflect the reality of the change in our name. And though it's not specifically covered in the report, just wanted to confirm that Craven's status remains unchanged and will remain part of our West Yorkshire system. Just to close on next steps, now that we've had the final guidance and the model constitution issued, we're ready to crack on with drafting a draft constitution and working through the practical implications of how we'll involve stakeholders in developing that. We're absolutely clear that system partners need to be engaged throughout, and we'll continue, as we've done over the last few weeks, to engage with health and wellbeing boards, other place-based forums and system groups, with an aim of bringing a first draft of that constitution back to this board in December. We've talked in a number of groups about the importance of testing our arrangements in some partner workshops, which we're now planning for later this month and October, and place leads are developing a range of scenarios to test those arrangements, and we want to involve statutory, non-statutory partners, non-exec and lay members, VCSC, Race Equality Network. We want those workshops to be as comprehensive as possible. And finally, just something on transition. Given our strong leadership and governance arrangements, I think in many respects we're already operating in shadow form and are well placed to move to the next stage from November. So my sense is that the move towards statutory arrangements from April 22 will be more of a gradual transition for us rather than the step change that some systems are anticipating. So conscious that's a pretty rapid run through what is quite a complex set of arrangements. Welcome comments on the work to date, and ask the board to note that we'll be bringing a further update to the next meeting.
Thanks very much, Stephen. Can I see if anybody's got any questions or comments? I know a number of us have other opportunities to input to this through the chairs and leader groups and others. Okay, Simon.
Councillor Swift. Stephen, I think it was just about a comment from the Race Equality Network, because they really welcome the approach to have that diverse representation in these governance groups. But I just wonder whether we need to be explicit in what expectation we've got, so what different outcomes are we hoping to get once we've got the representation? Because I think there's one stage is getting the representation, but then there's something about what then happens as a result of having those people as part of those conversations. And another point the Race Equality Network wanted to bring up was thoughts on equality impact assessments on papers and decisions that are made that may impact people. So just thoughts on that. Thank you.
Thanks, Simon. Any other comments? I don't know, Stephen, where we feel it's appropriate to kind of capture that point about equality impact assessments. Perhaps just comment personally. I very much welcome the guidance about good practice in terms of governance there, and the commitment to applying that at all levels, and particularly points about transparency, which I think are really really important. What I'd expect, but clearly not necessarily what's taken as a default in other ICSs, and an area that the legislation leaves open. Which order do you and Rob want to go in? Should I come to Rob next and then back to you, Steve?
I think Stephen might have wanted to answer that question. I was going to ask Simon something, so if you want to pick up with Stephen, that's fine.
Okay, Stephen, you first.
Yeah, just in relation to those the 2 points from Simon. Yeah, we recognise the need to be more explicit about the outcomes that the arrangements are going to deliver, and within our standards, we've set out an aspiration to be much more specific about how the governance arrangements contribute to a range of outcomes, which are in part of the big ambitions, and some of that, one of those clearly is around diversity of leadership. So we do need to. We've recognised that we need to do that. There's some work to do about how we actually. The detail of how that works in practice, and the point in EQ about EQIA as well. Again, that's something we picked up in the standards, that where appropriate, absolutely, reports that come for decision must be supported by EQIAs, and yes, so we've got both of those in view. There's still some work to do on the detail of how it works in practice.
Thanks, Stephen. Rob?
So just a reminder to the board that we agreed that in our organisations and our systems we would have representation in all decision making. That was a commitment that we made 18 months ago, and I think we demonstrated that pretty well, and we've done it where there's been representation naturally, if you like, because we've got diverse leadership. That's straightforward, and to boost that where that hasn't been straightforward, we've relied on the staff equality networks. And I'll spare her blushes, but I was saying that if you looked at the minutes of these meetings, you'd probably find that Simon's quite one of the biggest contributors to the conversation, which is a reflection of the fact that Race Equality Network have a say in what we're doing. So I guess one of the questions that I've got is, how do we make sure we have that representation? Do we want? Does the network feel that this is an effective way of doing it, where we're not able to do it naturally, if you like? And what does a good outcome look like from your perspective? And would you help us to make sure that we got that right?
Thanks, Rob. Simon, do you want to come back on that, or is it something you wish to take?
Yeah, just absolutely. I mean, trying what Rob's saying, and I think for us as a network, when we've had a discussion on what good looks like, I think it's spreading some of what good practice we do here with these forums across place as well. So something about sort of the place representation as well with the diverse groups. But we'd really appreciate the opportunities we're getting. And I absolutely agree with you that diverse representation is happening, and it's spreading into lots of different decision-making forums. And I think that's why the point that the network wanted to make was that we feel we've done that, I suppose, first step of having the representation. Now are we explicit on what do we then want to see now that we've got the representation?
Thank you, Saima. Okay, I'm not seeing any more comments on that. So we're asked to note and comment on progress, which I think we've done, and clearly to have a further update to the December meeting, although noticing that other timeline may well cut across this as well. So if people are okay with that, not seeing anybody else. And noting what we've agreed to do regarding the measuring 10 big ambitions and the way we've agreed to handle that, could I then just thank everybody for your contributions? It became a really, really good and lively meeting, particularly after the tea break. Perhaps we'd have to have the tea break earlier. No, but seriously, that was really helpful. I thought some really, really interesting and challenging discussions there. Thank you everyone for your time, and we'll see you at the next partnership board if I don't come across you all before then. But thank you very much, everyone.
Thanks, everyone.